Come into the room, family. Come into the room. Welcome. I am the H-Town Vet, and I'd like to welcome you to our channel, a place where we will discuss a variety of benefits available to veterans, active duty members, and their dependents. Come on into the room, family. First person in was our sister Betty Bops, and she says, H-Town, good evening. Good evening to you, my sister. She goes on to say, H-Town, hope you had a beautiful weekend. It's been wonderful, busy, but wonderful. And then we have our brother. I did say something back to her earlier. Hello, sister. Brother Jason M., you left a message on the chat earlier, then it would disappear. Did you delete it or something? He say, hello, H-Town fam. Because I want to make sure, Jason, ain't nobody that the YouTube is not messing with our live stream. Did you delete a message earlier? Because it was up there. I responded. And when I came back, your message was gone. Now, listen, Sean say, good evening, H-Town. Good evening, brother. Good evening, brother Sean. Hope everyone had a great weekend. Boy, just being here with y'all. Y'all just don't know how important y'all are. Y'all don't know how powerful y'all are. This is the reason I told you this months ago. The reason that we're setting up things the way that we are doing it is that we're preparing for when it grows. Because as we grow, you see all type of stuff pop up. San Diego Marine says, evening, veteran family. Yes, indeed. Everybody's speaking to him. He's speaking to everybody in the vet. That's one, and he speaks to me. You spoke to us all, and he's speaking again. H-Town Vet, evening, sir. Evening, brother. We have 66 Love in the room says, good evening, H-Town family. Yes, indeed. Jay Oliver's in the house. Jay Oliver says, hello, all. And then look at all my beautiful female veterans in the room. We got Betty Bops. Now we got Farm Girl Rebel. Family, Farm Girl Rebel say, evening, fam. Then we have Sister Alaskan Ice, a.k.a. Will Win Big. Say hello, everyone. Sister, thank you for all of the fabulous information that you're giving me. Betty Bops, you gave us some powerful information. And Charlton, too. Thank y'all. And I appreciate everybody show love to our sister, Alaskan Ice. Yes, indeed. And the rest of the J. Oliver. Yes, indeed. And Farm Girl Rebel. Yes, indeed. Family, we doing this thing. This is what it's all about. That's what we come here for. Huh? May she say, and H-Town. Thank you, Farm Girl Rebel, so much. Let me tell y'all something. The channel is having an impact, and I realize how much. We're about, how far are we from it? Give me a second. We have right now, when it comes to subscribers, we're at 2,893. Okay. And how many do we need to get to 3,000? If we have 2,893, I'm going to put it in there. Subs. How many do we need to get to? We have 2,893. How many do we need to get to 3,000? Come on now. It's got people wilding out. I don't know. Betty say 107. San Diego Marine say 107. Betty says 107. Okay. And then we have Jimmy Elmore says hello. Everyone says hello. Yes, indeed. Family, I'm so glad that y'all here. We got y'all up on the chat. We're going to go ahead and get started. We thank y'all for being here, and we thank you, and we appreciate you. For all that are new to the channel, you might be watching live or recorded. I am the H-Town Vet, and we welcome you to this live stream, a place where we will discuss a variety of benefits available to veterans, active duty members, and their dependents. I suggest you get here early because we're going to be getting right into the information. I want to thank you for showing up. I thank you for being here, for your kindness, support, backing me up. watching out for H-Town, because H-Town, sometimes I feel like I'm out on the island by myself when it comes, because very few people deal with me nowadays. I ain't talking about the subs and the viewers. On the other side of the game, I guess they think I'm scared. They don't know me, do they? Oh boy, your voice matters here. Your voice is just as important as anybody else's. Your voice is just as important as my voice or any other content creator. And the rules are simple, okay? Rule number one, talking about yourself, and this applies to me also, and this applies to content creators because I've had to block a content creator, a couple. As a matter of fact, yeah, a couple. Rule number one, I will be respectful to host and chat while staying on topic. Number two, rule number two, I will not attempt to network or promote myself or others in the chat. Yeah, give me good contact. I'm holler at you. Not, we don't do that here. Number three, I will not divert chat members away from the channel. Now, the reason we read these because the people that have ill intent, they not paying attention to this. Like y'all say, why read it, H-Town? Because it's for all the rest of y'all. So when y'all see me getting rid of them, y'all won't be saying, oh, H-Town did them wrong. H-Town made it clear. And the fact that I'm willing to block anybody, whether they content creator, or viewer, or troll, it don't matter. But we do it in a respectable way. We respect people on the way out. Huh? We respect them. We have U.S. Army Grunt say, H-Town Vet Northside, hello, sir. Hope you had a great day. And hello, H-Town family. Everybody show love to Jimmy, our brother Jimmy, and U.S. Army Grunt. Thank you. Yes, indeed. The circle got, in the words of Nipsey Hussle, the circle got smaller. Everybody can't go. Huh? Now listen. The after party, if you got anything you want to talk about, you can talk about it then. If you have some debate, you got you got hater debate or something you want to say, you don't agree, when we get to the after party, you can do that. When we get right to it. We've been cutting a lot of stuff out. All right? And what we want you to do, if you haven't had a chance, smash that like button. Our sister says she's sitting in the decorum of the room. Sister Betty Bob says, thank you for joining the H-Town Vet live chat. Please stay on topic. Your comments will be addressed in real time. Respect the host, H-Town Vet, and the live chat. And one way you respect me is respond when the host asks you something, that you respond. You don't ignore me on the platform, okay? If I ask you something, if you don't know, tell me you ain't clear. Because I said, what did you mean by that? That means that's something you need to answer. Do not distract or engage others with off-topic discussions. Comments that do not follow these guidelines will be blocked. The comments, not necessarily you. And if you have, let's say you just got an increase, you can tell us about that. And here's the other information. By following the guidelines, and say wait until the after party. There's the information, please read over it. And it says, in the after party, you'll have access to knowledgeable individuals like Alaskan Ice, including former VSOs and Raiders, and experienced members who have successfully navigated the claims process. Of course. Yes, don't promote your organizations. We have to learn. Look at the information. And hit that like button. Please like and subscribe. We are looking forward to having you in our space. Now let's get to it, family. I'm so glad that y'all are here. We're going to talk about this information. Yes, indeed. Now it's time to get on topic. Time to respect the host, H-Town Vet, and the chat members, and enjoy the live stream. Please do so. So we all working together. Ain't nobody, I need all y'all. Okay, now it's time to get on topic. Any questions and answers on topic? And the topic for tonight is we're going to talk about these pain meds, okay? Because that was an interesting thing. A lot of y'all had said that y'all had struggled with issues with pain medications, and we want to address that issue because I didn't know so many veterans had struggled with problems with getting addicted to pain medications. Now, if you've had any issues, so in particular, the topic is, can veterans receive VA service connection for addiction to pain medications? Have the VA ever subscribed you to any medication, meaning the VHA, the Veteran Healthcare Administration, that had addiction issues, or it caused you had to get addiction? You had to tell them, hey, this is becoming addicted, because a lot of these medications, some of them for pain, can be addicted. Or you were taking medication that was for your service-connected disability in particular. That's what we're talking about, okay? Let's talk about it. If you've had issues with medications that you got for your service-connected disability, and it caused you to have addiction issues, or it would seem like it becoming a problem, you need to change the medicine, put a 1 in the chat if you've ever had issues. You don't have to if you don't want to, but you let us know if you would like to. Put a 1 in the chat, because last time y'all really opened my eyes. Thank y'all for being so incredible here tonight. Because others, I didn't know this was an issue. Now, put a 1 in the chat if you had issues with it. I never had, because I don't take much pain medicine. Betty say yes. And I want to ask you, everybody show love to our brother Charleston. And he said, hi, Ship May, Betty Bob, Jason M, Sean, San Diego Marine, 66, love J. Oliver, Farm Girl, Rebel, will win big, aka Alaskan Ice, U.S. Army Grunt. Yes, indeed. Okay, so this is an issue. Yes, indeed. There was some question I was going to ask you about that. Say they hate to give it. I have a very low dose for back pain, so I was in a lot of pain. Well, Alaskan Ice, they give it to certain people. They discriminate against particular Black people because they didn't want to give me no pain medicine. They try to give me, but other people, I talk to other people. I talk to white dudes, they get it all the time. They say they can't stop getting it from them to them. But to me, I never had a drug issue in my life, and I was in pain. And she finally, the white medical assistant or whatever, finally told me, well, we don't want you to get it. We don't know if you're addicted. I said, I don't have no history of being addicted. She caught herself. She didn't realize she had told me. I say, so you give to everybody else, but I'm supposed to suffer with pain, because they say Black people have a high tolerance of pain. That's why so many Black women, when they're in surgery, they don't want to give them the pain medicines. Why other people get the medicine, selling it out on the street. This has been an issue. I'm just telling you the truth. Come on now. Yeah, I had that thing too. You almost got to convince them. If I'm in pain, I'm in pain. Who in here has had problems getting pain medicine from their doctors? Put the word problem in the chat. If you had, and this could be anybody, who've had problems getting pain medicine for pain issues, put problems in the chat. Anybody had problems? Let's see. Now, sister say, they even did a 90-day check to make sure I had not had it. Oh yeah, because there's a stereotype that Black people are, and I don't know Alaskan Ice. I'm assuming she's Black, because that's so it don't just happen Black people. I'm sure that's why I say let us know. But I'm telling you our experience. This is statistically proven. Betty Bob say problems. Java say problems, had to contact patient advocate. It got that bad. Now let's see what our brother Jason M said. I had that I'm gonna call it 10 for my 10. Okay, for my pain, my PCP provider gave me Tylenol 3, but for her to keep giving it to me, I had the P test every time the VA want. Okay, now listen, family. Let me ask you this here. Do you think that sometime the VA, especially the VA hospital, they see us as some kind of like we're in a prison, or we're offenders, like correctional offenders. Do you ever think they run the VA hospital like a prison sometimes? Like they checking us? Because I remember when I went through the outpatient program, they made us do a urinalysis test. Okay. And they watching us do it and all. They had a woman watching us from behind a glass and stuff. I don't know, man. Sometimes I feel like it's a prison approach. And is that necessary? Maybe, I don't know. San Diego Marines say problems. Now listen, here we go. We got other problems. Jimmy say pain medicines cause me constipation right here and hard on the kidneys. They are. Ibuprofen. Ibuprofen don't work for me. I just don't do that. Civilian doctor stopped pain meds because he was state regulated. No problem. VA getting drugs, pain, dope, especially. Well, I have problems getting it, and I don't ask for it much. I don't really have many pain issues. They dance around. Now, family, let's talk about it. Well, y'all having good. You can get service connection for addiction to painkillers, but it's going to be a secondary connection. All right. The way it works, let's say you had an injury, some type of dental injury. Let's say in particular, you got a rating for it and you're service connected for a dental injury that causes you pain. So that's the step one, having a service connection, whether it be for a mental health condition, whether it be for like PTSD in particular. That's the main one, because you don't know PTSD is associated with pain too. Who knew that? If you knew that PTSD is associated with pain, put a Y in the chat. If you didn't know that, put an N in the chat. Did you know that? I knew it, so I'm going to put a Y because I'm the one who said it. You can also, the first service connection could be PTSD. Now listen. See, that's why we talking, brother. See, you teach me stuff, San Diego Marine, and I'm going to teach you some things. See, that's, yes, indeed. Yes, indeed. Having PTSD, I learned that over time. Now listen, 66 Love say, yes, you knew that. Take step one, take the dental away for a second and put PTSD. Yes, that could be you can get pain medicine because of PTSD. Yes, 66 Love knew it. Jay Oliver, yes, knew it. Sean, no, did not know it. That's why we're here, to teach each other. Jason M say, didn't know it. Come on now, fam. Jay Oliver, Charles say, Jay Oliver, I met back in 2002. Okay. And say, I will, let me get that. I can pull that for a second. Then we have Betty say she knew. Alaskan Knight say, yes, she knew. Jimmy Elmore did not know. That's why we trying, I'm going to try to be topical, meaning I'm going to go over some things about pain, and we're going to talk about pain in different aspects. Then we're going to go over different things, different type of issues that we usually don't cover, so we can get this out there. Jimmy Elmore didn't know. U.S. Army grunt didn't know. These are knowledgeable veterans that did not know. And I want you to understand how it works. So let's say you got a tooth problem for you. It could be an ankle injury, you name it, as long as it's service connected. You have to take pain medicine for a service connected disability. So let's say it's your tooth. You got teeth or whatever, some type of dental issue. You take step two, you take the medication, okay? Pain medicine for it. Step three, you get addicted to the pain medication. Your addiction must go back to the service-connected disability, meaning you have to be taking the pain medicine because of a service-connected disability, not because your VA doctor at the VA hospital gives you pain medicine. If it's for the service-connected disability, you can get addiction. If you become addicted, and we're going to clarify what that is and how it works, the addiction and the treatment and the evidence. You can get it as long as it goes back to your service-connected disability and you develop an addiction to it. Let's see, same as getting connected for alcoholism. If you rated issues because of it, it's a secondary. Yes, indeed, it's a secondary condition. So the addiction would be what? secondary to the tooth, the painful tooth or whatever dental work. And the pain medicine is what they call it. It's just like weight gain. What would be the pain? It connects the two together. Something that connects a service connection to a secondary condition, and it's not directly related, but it's related to something like weight gain or pain medicine. What is that called? What is that called? A what? The second step, the pain medicine acts as a what? It begins with an I. Anybody know? Let us know, family. So you don't get service connection for the pain medicine. It is a what? Enter what? Enter. Anybody remember? Let us know. It acts as, somebody gonna come up with it, acts as an, there we go, an intermediate. Yes, indeed, intermediate. Yes, indeed. That's what it is. So the pain medicine is a bridge, a backwards bridge. Once you get the pain medicine and it causes the addiction, that backward bridge leads to the service connection. Come on, family. Y'all putting it in there. Look. Yes, right. Intermediate, intermediate, intermediate. Yes, indeed. Family, that intermediate is important. And I want y'all to understand that. I got to ask y'all a question. I want y'all to be honest. Before we talked about it tonight, did you know that you could get service connected through pain medication? Before I brought up this issue, did you know that you could addiction to pain medicines could get you a service connection? Yes or no, family? Let us know. Put a Y in the chat if you knew it. Put an N if you didn't know. If you knew that you could get service connected for pain, so put a Y in the chat if you knew that you could get service connected and use pain as an intermediate for a service connection as a secondary to a secondary condition. Put yes in the chat. If no, say no. So San Diego say no, sir. Didn't know. Alaskan Ice did know. Okay. Yes or no, family. I just found out when I did this, when I did research on this. And what she said is the side effects. Okay. Betty says hold on, boy, y'all moving fast. Keep moving, keep moving. Good thing. No, she didn't know. 66 Love did know. Yes. And it's the side effects. They're paying you for the residuals. That's right, the side effects. Let's talk about it. Now, T, let's see, say, Sean say no, didn't know. Jennifer, yes, and alcohol also. We're going to have to cover alcohol one day. Betty said yes. Oh, Lord. Charles say maybe. How maybe? That's like asking your wife if she's pregnant. Maybe. Do the test. U.S. Army Grunt say yes, they knew. Benny, everybody show love to Benny, say he knew. Jimmy Elmore did not know. Teddy Brewski. Look, I want to apologize to you, Teddy. I got to come up on the screen. You was giving your opinion the other night. I just was in the middle of handling something, but I your opinion, it matters here, and I agree with most of what you're saying, brother, if not all. Listen, but I was in the middle of something. You speak true, man, and I thank you, and I apologize. But I was in a little trick bag, and I had to be careful what I said. But I love you, brother. Thank you. Everybody show love to Teddy. Teddy say no, he didn't know. Because Teddy really brings solid information up in here. Benny said, hello, H-Town Vet and the chat family. Family, I didn't know. I'm kind of embarrassed because I didn't know that the medicine that you get addicted to, that you're getting treated for a service-connected condition. Say, you're good, OG. I didn't take offense at all. Yeah, but I need to do better, bro, because I was in the middle of something, and I'm already I'm already handling one. I had just put out one content creator, and they're playing nice, and so I don't need no beef with people because I got love for people like that, and I like to see people channels grow. But I'm going, handle my business when I have to. And I thank you. And you speak your mind here. Thank you. Now, family, let's get into it. And family, as we said, I want you to be clear. Whenever you're dealing with something like pain medication or obesity, they are intermediate step to a secondary service connection. I hope you follow. Tell me, family, is that clear? So if you have a dental problem or injury that you take pain medicine from, a dental problem that's service connected that you take pain medication for, subscribe. It's prescribed. Prescribed, and you become addicted to that pain medication. Well, you got a secondary service connection for the addiction. It's like an opioid addiction. Okay, it really is pretty much an opioid addiction. Now, family, it all starts one place. Prescription from your doctor. Somebody who in here has ever got a pain prescription for any condition that's service connected? I haven't per se, because I didn't realize PTSD is pain related. Whoever got pain medicine for certain, putting me in the chat. If you've gotten a prescription for pain medication from your doctor, put me in the chat. Come on, family, let's talk about it. Let's talk about it. Betty Bops have gotten pain medicine for a service-connected disability. Come on now, we got to talk about this. So has 66 Love. So has Alaskan Ice, aka Will Win Big. Jay Oliver say me, 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 me. Then we have Benny say me. San Diego Marine say me. See, this channel is interactive because you blessing other people and me and yourself. Because you helping people, fam. Come on, let's talk about it. Jimmy Elmore say me. Now, I'm kind of real upset right now, family, about something. And you know what? It just came to me. The same medicine that causes us to get addicted is the same medication that will cause us to become obese or gain weight. Am I lying or telling the truth? The same medication they give us that cause us to gain weight also can cause us to be addicted. Come on now, that's two intermediates. Seem like you can get two service connections for that, huh? If a secondary is different. Man, now listen to what Jason said. I got to find out more about this medication. Jason M says, so can I get rated for addiction to, yes, after that's GABAPENTIN, after I take 1,200 milligrams, I'm like a zombie. But are you addicted to it? Do you have to have it? You can get rated for the side effects. Yes. Yes, you can. I think Alaskan Ice said that earlier. So Farm Grub Bubba say, me. My Lord. You got a prescription for pain medicine. Say, hello, Farm Guru. How you been? Yes, indeed. No lies told. Oh, you say, me too. She say, Alaskan Ice say, me too. Not the movement, the pain medicine. Come on, let's talk about it. Uh-oh, VA is the candy man. Come on now. Where the candy at, candy man? Huh? Now, I'm going to ask y'all another question. Somebody just mentioned earlier. Yeah, y'all speaking. I ain't got to pull all of that. Yes, and I won't sleep. Okay. VA slick. They would come up with dental for pain medication secondary. Yeah. They something else. Look who we have in here. And I remember seeing them over on Raiders channel too. That's my family last name on my great grandma's side. Bird, T-Bird, what you doing? Oh, he's talking to our brother. Good to see you. Oh, man, it's so good. Everybody show love to T-Bird. T-Bird. That's Bird. That's how my family name is spelled. The Bird side. Huh? Everybody show love to T-Bird. Come on now. Give me your testimony tell us about how y'all go through this stuff. Because other people didn't know. I didn't know you could get addicted to the VA medication. I'm naive to it. Now listen, had my only withdrawal symptoms come off a prescription, horrible. That's one part of the evidence. If you ask, do the medication, the pain medicine give you withdrawal symptoms? And I remember our sister saying that she went through this a little while ago, a few months back. Bugs crawling on my legs, brain feeling like it was being electrocuted. Who've ever experienced that? Huh? If you felt side effects like these, if you've had any side effects from your pain medicine or withdrawals, huh? If you felt any withdrawals from your pain medicine, put ATM like an ATM withdrawal. Put ATM in the chat. If you felt withdrawals from pain medication that the VA give you for a service-connected disability, or not, because it might, that condition, you say, okay, T-Bird, hold on. Oh boy, hold on, what is that? Give me a sec, I gotta turn this off. Sorry about that, family. I thought I had both my devices off. T-Bird. Is that for T for Thunderbird? Oh, don't say it. Put ATM in the chat if you've had withdrawals from pain medicine. Put ATM in the chat. Let's talk about it. Charlton say, primary care asks me all the time about family medical history. Any parents addicted? VA would say family druggies. Do you understand? Once you put it in there, tell them I don't, you know what I say? I don't know none of my family history. I don't know what that's their personal private medical history. That falls under HIPAA. So what you ask me about somebody else's personal medical history for? That's under HIPAA. I can't give out their personal information. Huh? But they say it's HIPAA until it's talking about our family. That's hypocritical, ain't it? Farm girls had ATM withdrawals. You know, it's oh Lord. She had ATM, she had withdrawals and had seizures. What are some of the side effects? Let's put some of the side effects in there. So our sister say seizures. Our sister say, that's what Betty Bob say. Our sister, Farm Girl Rebel, say she had her brain feel like it was electrocuting, and she had like bugs crawling on her. I remember that now. She was telling us about that. Yes, indeed. Our brother has had withdrawal. So does Jay Oliver. Farm Girl Rebel said, holy cow, Betty, how awful. Everybody pray and show love to our sisters and brothers in here going through this. Now listen to what our brothers say. T-Bird say, I just graduated from Tramadol to, I won't say Tramadol, to Tylenol 3. Dang. SI joint pain. Wow. Family, how can we get away from the pain meds when we be in so much pain? Say, got it. Wow. Tim. Woo, Lord. Family, y'all starting to mess with my mind now. That Tylenol 3, family, y'all keep bringing up that Tylenol 3. Does Tylenol 3 work? Put T3 in the chat if Tylenol 3 works for your pain. And let us know if you're having side effects. If it don't work, put T3 and no, or X next to it. T3. That's Tylenol 3. I want to know, does the Tylenol 3 work, family? Which one you like? Do you like Tylenol 3? Some people talking about that Tramadol. Some people say it works. Okay, some people saying that the Tylenol 3 work. Some say that the Tramadol work. Let's see what y'all got here, family. Ooh, family, this is getting heavy up in here. I got to catch up. I'm going to get down to y'all information. So, hypocrite. Yeah, they asking about your personal family. Think about that. How you gonna ask me about somebody's personal medical information that's covered under HIPAA, but you want me to tell you, then you go and report it. Use it to keep from giving me disability because you're gonna say my addiction is hereditary. You remember how bad the crack epidemic was back in the 80s? Was one of your parents on crack? Was you born a crack baby? Huh? Well, your addiction comes from that, not from the medicine we just gave you. Where is Doc Shelley when we need him? Boy, he would be good. A don't have an addicted personality. Well, y'all getting into it. Thank you so much. To say, all right. So Jimmy Elmore said, "I love Tramadol. It works for you." Okay, that works for you. So I asked y'all, some of y'all, about the Tylenol 3. Say, now listen to what J. Oliver said. Stomach issues, numbing, dizziness, brain fog, dry eyes from that doggone. I'm assuming you're talking about that Tylenol 3. So Betty say seizures with the Tylenol 3. Family, I thought Tylenol 3 was the solution, but now y'all got me concerned. Tylenol 3, dang right, it does. Hard to get. Yes, hard to get that. Hard to get that Tylenol 3. There's a Tylenol 5? Who ever heard of a Tylenol 5? I've never heard of a Tylenol 5. They have Tylenol 5, but don't issue it. So what they got it for? Hold on. Who ever heard of Tylenol 5? Hold on. Give me a second. Question. Has anybody in here heard of Tylenol 5? Put yes in the chat, or a Y for yes and an N for no. Have you ever heard of Tylenol 5? H-Town has never heard of it, but I'm going to put an N for no. I've never heard of Tylenol 5. This is, boy, y'all getting me. I didn't know this pain conversation was going to take this turn. I never heard of Tylenol 5. Alaska Nights, we need you around more. They have Tylenol 5, but don't issue it. Boy, you just open our mind up. That's why we need you. I'm going to throw every guilt trip I can. I know you're a busy person. You taking care of your life, but we miss you. My favorite is when I was asked if I had the pew-pews in my house. None of your effing business. That's what I'm talking about. Probably need Tylenol 4. Okay. Fam, I had never heard of Tylenol 4. I heard of 3. Mayo asked that. VA probably assumes yes. Now, let me ask you, when you go to community care, have they ever asked you about your weapons in your house? Tramadol made me throw up. Okay, so never heard of Tylenol 3. Wow. Can only get Tylenol 5 after surgery. I had Tylenol 5 with ACD neck surgery. Oh, see, T-Bird, we thank you for bringing the truth to us. You're educators. You're not my bus driver, Mr. Bird, but you sure took me to school. Now we have Farm Girl Rebel says, Tramadol makes me ill too. Why some people it affect bad, some it don't. And we asked, did anybody ever heard of T5, Tylenol 5? I hadn't, so I put no in the chat. Our sister Alaska Nice, aka Will Win Big, say the DULOX Deluxe 10, 60 milligrams for pain and mood. Oh, so it helps with the pain and the mood. Now, thank you, Alaska Nice, for what you said, because look how many people did not know about Tylenol 5. H-Town didn't know. Sean didn't know. Benny didn't know. Jimmy didn't know. U.S. Army Grunt did not know. Teddy Bruschi didn't know. Farm Girl Rebel say no. T-Rex of Tylenol. It's the T-Rex of Tylenol. It's the bad boy. So say, I didn't know Tylenol had numbers. Wow. Okay. Well, I can't say it. Sure, if that's your image, you white, so that means they left you out too. So it may not be all racial. They didn't even tell him about Tylenol 2. I ain't laughing, man, but I'm like, God, no. They did tell me about Tylenol 3. I'm sorry, because I got it for dental. So I'm sorry. They left Sean out. Why they gonna leave my homie out like that? Huh, that's my fellow Houstonian. We gonna go full. Oh, we ain't gonna say nothing here. Tylenol 5, no, from Betty. Charleston say, I got hooked on Tylenol, methadone. Bet is one of those 2, 3, 5. Now I'm gonna ask you this here ones. Let me ask you, isn't, if I'm correct or not, isn't, so I don't know how opioids work. Wouldn't Tylenol, would that be considered an opioid? Would that be considered an opioid? Will Win Big say, I heard about it 4 years ago. Maybe they stopped making it. Well, we know that Mr. Brother Bird did get some for surgery. They give it out, the 5. Now, I could have used that. Yes, indeed. Maybe they gave it to us during our surgery. I don't know. Community Care asked if I was depressed, thoughts of self-harm just 2 weeks ago. Did y'all hear that? I was wondering, was they asking questions? Community Care asking questions about your mental health and or self-harm. Say, Dula did, I want to say, for me, after surgery, this farm girl, knocked me out so far. My son called 911 and he thought I was dead. Yikes. Wow. Whoa. Man. Did you take it after that, or you took smaller dose? Ooh, Lord. Y'all got me. Y'all working me. Y'all got working my brain tonight. So never heard of it. Okay. No, they don't ask you nothing about your mental health. Okay. No, Jason. Now let's see what we got. I sorry to hear that, farm girl. Thank God your son was there. Now Teddy say, if I had $1 for every time I have been asked if I had been asked about my weapons, LOL. Boy, we had, when the last time, if they ask you, do you need a gun lock? Put a lock in the chat, or the word lock in the chat. If they ask you need a gun lock, put the word lock, or put the lock emoji in the chat. If they've asked you, do you need a gun lock, the VA hospital or anywhere. Tylenol 5 or Community Care. Tylenol 5, Houston Stone. That's Houston Stone, ain't it? Hey, that's all. Well, this and that. What it used to be back in the day, real bad on Montrose, boy. That was the spot. It was on and popping. Farm girl, I'm glad I did not take that after surgery. Lord, just think how weak you are after surgery. If she would have took something like right after surgery. Now listen to what Charles say. Tylenol mixed with dope, insane pill. Wow, that's what we're saying. I didn't get any during surgery. This is what Alaska Knight saying. Did get a stronger drug the day of the surgery. Okay. And Farm Girl Brother say, Betty, that stuff can really take a person out. DULAUDID is wicked for pain relief, but easy to OD on, especially if you don't have that history. But y'all got me nervous. I've been asked the question, do I have locks or for weapons or whatever? Do I need any? So has no locks given. Say that's like no blanks given. But I understand. They give me locks without asking. Oh, okay. They just gonna give you the locks. This is my gun safety, sir. Now, family, let's continue. Let's see what y'all got. Y'all know how important this engagement is that we're doing here. Alaska and I say, I got this for breakthrough pain for a week. Okay, that's what you got. Oxycodone 5. What milligrams is a strong prescription narcotic? I think I got caught on for dental, real bad dental. I want to say allergic use to treat moderate to severe acute pain by changing how the brain responds to pain. Wow. I've been giving codone pills back in the day. I think they're real tight on them now. I was giving, when I had certain pain, they did. Sorry. It's Tylenol 4, not 5. Tylenol 3 is Tylenol with 30 milligrams of codeine. Tylenol 4 is 60 grams of codeine. Y'all remember when they used to put codeine in cough syrup? Didn't they used to do that? They used to call it a certain thing. Liz Charles say dope, the fancy name, still dope. That's what we're trying to get to here. Yes, indeed. Bird say the VA is giving us Noxilin for narcotics. Okay, with narcotics. Okay. Thanks, Betty. I found out that I am already reacted to these types of opioids. Oxycontin is the strongest. Oxycontin is just the equivalent to opioids on the street. It's the medical equivalent. Let us continue, fam. I didn't know y'all gonna be so interactive here. So once you got the prescription for the doctor, you fill the prescription. Where do you get your prescriptions filled? Do you do meds by mail? Do you pick them up from the VA? Do they give them to you through My Healthy Vet? How do you receive your meds, family? Do they do it by mail? I get mine by mail. How do you get your meds? Meds, I put meds by mail. How do you get your meds? I get my meds by mail. Let me see. Meds by mail for me. How do you get your meds? U.S. Army Grunt by mail. Alaskan Ice by mail. Now listen. So Jimmy Elmore does both. He goes up to the VA and pick them up, and he does it by mail. Okay. Tell us how you receive your meds, okay? CommuniCare pain management filed by the VA. So where do you pick the medicine up? From the CommuniCare doctor, they ship it out, or the VA approves it through CommuniCare. When you're in CommuniCare, this is very important. How do you get your medications? From the VA or from CommuniCare themselves? So our brother Sean say mail, like me. Yes, we get it through U.S. Postal Service, FedEx. We get it. It could be either one. I say mail. It could also be shipped through FedEx or UPS from the VA, Jimmy Elmore. Okay. Y'all let us know. Come on, let's talk about it. So you get your prescription. You got your medications. It's important to take the medications as prescribed. If they say you need to take it after you eat, do what the instructions say. If they tell you you need to take only so many a day at a certain hour period, you need to do that. If it's not working, you need to contact your nurse, your doctor. You need to contact your doctor or the nurse for the doctor so they can contact them. Who has had to, within the last year, the medicine didn't agree with you and you had to get your medicine adjusted or changed? Who had to get their medication dosage or the type of medicine changed? Put change in the chat. Put change in the chat if you had to get your medications changed because the medicine, you were having a reaction to it. Now listen to what T-Bird says. Doctor sent script to VA pharmacy for you. Okay. All right. Charlton say, when post goes belly up, I'm sunk. No, they're gonna use UPS and stuff like that, hopefully. You ain't that far out in the boonies, are you? Even out there, they're gonna get you straight. We're going to make sure. Alaska Night say, I had gotten medication through the mail and picked orders up by CommuniCare. Did not know that. I didn't know you could get it to CommuniCare. Shipwreck. So who had to have their medicine changed? Sean has his medicine changed. Okay, because it wasn't acting, wasn't agreeing with him. Betty, so if you're having problems with your medication, please let your doctor know. Don't suffer in silence, because you don't want to be taking something that's why you need to contact your doctor. Don't just say, I'm not going to take it at all, because you need something that they can put in the place of it. So you just don't want to ignore your health condition. Jay Oliver say changed. Jimmy Elmore say changed. Will Win Big say, after I lost weight, I had to get it adjusted. Oh, now that's Alaska Nights. That's a good thing. That once you lose weight, I lost 25 pounds, family. 25 pounds. I'm trying to get back down to my player weight. Not my player ways, but my player weight. Now listen to what changed. Oh, you had your medicine changed. Was it hard to get your medicine changed? What did you do? Who did you talk to? The doctor was it hard or easy to get your medicine changed? Put the word hard or easy to get your medicine changed. People need to know this. Hard or easy? Or does it depend on which medication? Is it hard or easy to change meds? Was it hard or easy to change your medication? Say meds interact with others. Yes, so the doctor, yes, indeed. So the doctor need to know, they should know that ahead of time. Was it easy or hard? Depends on the doctor, Betty says. Quite interesting, quite interesting. Now listen to Sean. Easy, use message system. Okay, now Alaska Night say easy through physician assistant. I was throwing up a lot. Okay, so you was having a real reaction to it. Now Jimmy said, I hate to hear that, sister Alaska Nights. Jimmy Elmore said it depends on what, Jimmy. It depends on what, Jimmy. What are the factors? Now Charlton say had hard to change, had to go to VA emergency room. I wonder why they give everybody show love to Henry. Why they give Charlton such a hard time? Who did you used to date a doctor or something, and you just made her mad, and she talked to everybody in the medical field? Why they give you such a hard time, Charlton? Or is it just, why is that? I don't get that. They always giving my brother a hard time. Teddy Bruce say it was easy for me, to be honest. It was easy for me. Now I gotta say it was easy for me. It wasn't hard for me. I never had an issue. So I hate for those you do have issues, we don't trivialize or downplay what you went through. What's up, H-Town family? Everybody show love to Henry. Henry, you spoke the truth the other night about how the channel, how it's a blessing that I'm the only channel with an open forum that people can express. I really appreciate you saying that. I'm gonna put that on the thumbnail. Don't get mad at me. I'll put it on thumbnail because I really appreciate that, showing how important y'all are. Y'all would say hard if the meds are regimented related to pressure or thyroid issues. Wow. Now here's the key. Now listen to what Jimmy Elmore says. Kidney doctor and heart doctor has the most strokes. You talking about the doctor themselves? Wow. Did not know that. Better about H-Town, congratulations on your player weight. I haven't got down to it yet, but I'm yes, I lost 25 pounds and I'm about to lose some more. Now with me, I ain't never had no man boobs. I'm good on that. I got to get some more stomach down. I was wondering why my belt, I was on the last notch, and I'm like, what's going on? Jay Oliver says, hi, Henry, everybody speaking. He said, Pisces, yes, indeed. They saying hi. Welcome, Naughty Ford. Henry Naughty Ford. Look, we could talk about the Betty Ford Clinic, couldn't we? Remember that the clinic? Everybody say hi to our brother. Look at it, Henry. They glad you here. I'm glad you here. Yes, they ruled the roost. My Lord. Woo woo. You go. It's a fun to lose weight. Finally, yes, indeed. Yeah, you know, my sister, I think you said you lost way more than me, and you are blessed. Now listen, and for those of you that are working or hang in there, okay, you're gonna do it too. And I'm trying to lose more. T-Bird say VA has a bad habit of making you try different drugs for neuropathy. Why do they do that? Some mess with the brain bad. Did not know that. I quit trying them and just said I did. Wow. I lost 225 pounds. If y'all want to say, if y'all want to say how much they lost and what your goal is, well, I lost 25 pounds. I know that much. I lost 25 pounds. Thank y'all. Farm Girl lost a whole H-Town. Yes, indeed. I lost the whole. You lost the whole. Yes, indeed. Oh, family, thank y'all. We trying to do it. Thank y'all. And we got Jimmy Elmore lost 25. Come on now, fam. Say, goal is 225. Okay. My Lord. Now, family, you get the medication from the VA, these pain medicines. You take them, all right? Because they prescribe, you're taking them. But then they start having an effect on your mental capacity, the way you think, the way you act, the way you move. When did you realize what was the factor, one determining factor? You may have went through all type of side effects. What was the determining factor that you knew you had a problem with being addicted with the pain medication? When did you know when you had the shakes? When did you know? So my goal is to get down to about 180, 190 maybe. Whew, that medicine, we good. Now, look at, oh, my, listen, Jimmy say, I still got 50 to go. Okay, we encouraging you on that because these medications also have the side effects of not just addiction, but also weight gain. I lost 13 pounds since April the 14th. Go, good did that. Jimmy Elmore say, changing meds for me is hard. Thyroid, hypertension, and a boatload of heart meds, and on blood thinners. Now that blood thinner is a game changer. That's some serious stuff. I wonder why they always tell you to stop taking blood thinners when you get ready for surgery or something like that. Sean say goal is 189. Okay, Sean. Betty say, hello, Jimmy. How are you doing after your surgery? Yes, indeed. Say, good on my surgery. That's good. Now listen to what T-Bird says. Lost 60 pounds in 1 month when I had kidney cancer. Oh, well, pray to you. Best diet is in the world, but won't recommend it. Come on now. Family, I'm so encouraged. And we need to keep on having goals. We need to have a goal. We're going to set goals on weight one day, and we'll try to, when you meet it, let us know. And we're going to try to encourage each other. Because it took me a while to lose the weight. I had gained it and didn't lose it. And I was just shocked. Sometimes you get discouraged, you know. Good on my surgery. That's good. Listen to Alaska Nights, aka Will Big, lost 58 pounds, family. Congratulations, Alaska Nights. What did you do? Charleston say, addicted cause it felt too good, not hungry. So let me ask you this here. If you get addicted to pain medicine, could that possibly cause you to lose weight because you're not thinking about food? I don't know. Is it like any other, like drugs on the street? Okay. If you have surgery, Alaska Night say you could bleed out. Oh, Lord, because the blood is thinner. Oh, Lord, thank you for letting me know that. Easy to bleed. Okay, thank y'all. Jimmy Elmore, congratulations on your weight loss. Yes, indeed. Congratulations, Alaskan Ice. Congratulations, Brother Sean. Jimmy Elmore. T-Bird, we don't like the way you lost it, brother, because we don't want you. We want you here with us. We thank God for you, and we mean that from our heart. I thank all my fellow veterans. Now listen to Henry say, VA primary providers assign meds based on their knowledge, ... But they should always consult a pharmacist before handing, but they don't have the time to coordinate due to lack of physicians. Yes, that can be dangerous because if they don't consult with the pharmacist to know how these medicines will interact, how your mental health medications will interact with your heart medications, how your heart medication might interact with your pain medicine, so on, so on, so on. Thanks. Okay, yes. Congratulations, Alaska Nice. Listen to our sister here, 58 pounds. What? I don't know that WTG. I don't know what that means. Y'all know the acronyms. I'm not good. T-Bird. Say T-Bird, sorry to hear that. Yes, indeed. Listen, Farm Girl Rebel say, got the first 80 off on my own, but still was struggling. Thankfully, because of my sleep apnea, I qualified for the GLP through the VA. Is that a weight loss medicine? And did you go through the MOVE program? Then Betty say, Sean, congratulations. Yes, congratulations, son. Now listen to what Alaskan Ice says. We're going to, was the only way I could do it. Okay. Now I don't know what Wegovy. I don't know what that is. Food stay in the stomach longer. Oh, that's the type of weight loss. Okay. Those type of shots cause side effects. Some have lawsuits, people going blind. I think there is a pill now. Don't they have that Ozempic or something like that? Say, I have pain management pharmacy doctor. Y'all need to do pain management. Get you a pharmacy doctor. Can you ask for a pharmacy doctor? So thank you. Last night say thank you. Weight loss medicine caused me to throw up in line at the airport. Luckily, I had a plastic bag. So some people like me have sensitive stomach. I can't take too much of everything. It's gonna come out one end or the other. Okay. GLP-1 is a weight loss peptide. They started me out with Wegovy. Hope I said that right. Made me sick, and now I'm on Zipbound. Lost an additional 80 pounds. People can abuse the stuff, but for most it works. Okay. So you saying Elmore say he on the Zipbound, and then ask for Dr. Feelgood. What you know about Dr. Feelgood? Radar HQ said it's saying to claim the kidney can. Okay, because of the situation. Okay, that's a good. That's why we are good at so many competent veteran channels out there. You know, that's good. H-Town example, I had appendix removed. Okay, this U.S. Army grunt. Could not do the same today surgery. Had to stay 6 days in the hospital to control change to be able to operate. Wow. U.S. Army grunt say, I had in hospital 4 weeks ago and lost. I was in the hospital 4 weeks ago and lost 15 pounds. My Lord. Seem like a lot of these medical treatments cause us to lose weight and surgeries. Former Good Rebel say, agree, Sean. Trizeptide, what is that? Trizeptide, Zepbound is awesome sauce. Okay. Can you get that through the VA? T Bird say, I claim kidney cancer to time at Fort Bliss because of the PFAS. I remember those claims in water, only firefighter foam, groundwater contamination. What did they deny or prove your claim, brother? Now, this is your brain on pain drugs. Wow, that's cold. That's cold. Fried. You remember that commercial? They took an egg and this is your brain on drugs. It fries it. Man, that traumatized the heck out of me. Now let's see. We got to say VA starts everyone with Wegovy because it's cheaper, but will transition you if you are getting ill on it. Well, they should stop giving it to people if it's making them sick. Now listen to what Alaska Knight said. You have to stop Wegovy and Olympic a week before your surgery too. You would lose your life, pass away. Radar HQ is to be submitting it. Okay, it's going to be submitted. That's good. So y'all teaching me something. I thank God for my brother Raider doing that in their business. Now let us continue. I'm caught up with the chat. Now, whoever heard this here? SUD, substance use disorder. Whoever ever heard of this? This is how you get rated, family. Called SUD as the abbreviation. Have you heard of it or not? SUD. Who've heard of it? Substance use disorder. Jimmy has heard of it. Who else ever heard of this or not? Sean, I never heard of it before I did this research for this live stream. Jimmy say, Suds, heard of it. Jim, brother Sean say, never heard of it. I guess J. Oliver heard of it. Charlton never heard of it. Nope. J. Oliver heard of it. Farm Girl Rebel never heard of it. 66 Love heard of it. Betty Bops have heard of it. That's why we getting it, because family, it's a lot of stuff we just know and don't know. Now here we go, fam. Y'all ready for this here? Now, diabetics get Ozempic. This is from Brother T Bird on the stronger doses, 2 milligrams instead of 5 milligrams. Everyone else gets Wegovy. Okay. Now listen. So let's go through this here right quick. He said, I worked in the hospital in my past life. Now, how to establish secondary service connection for pain, medication of pain, medicine addiction. Secondary basis. You must prove that the addiction developed as a direct result of pain medication prescribed for a already service-connected disability. So it has to be already service-connected. The medicine you're receiving for treatment is for a service-connected disability, and it causes the addiction. All right? Next thing you need. This is how you establish service connection, secondary service connection for addiction. Medical nexus, a nexus letter from a doctor linking the addiction to the prescription pain meds for your service-connected injury is crucial. Now, you can probably get it without it. You may have something in your medical records that show that, and we're going to talk about what is considered evidence, documented treatment records for the addiction. All right? Detox, some type of detox, some type of rehab. They giving you medicine to detox. You went to rehab for it, or evidence of the original injury that caused you to take the pain medicine. I hope we're clear there, right? So you got to have a primary to get the secondary, as you see in the picture. I hope we're clear. Now, we got more to tell you. It keeps giving me two of them, family. I don't know why I keep throwing two in there. Here's the second one. Key factors and concepts. Listen to me. SUDS, we just talked about that, right? What SUDS was. As a disability, substance use disorder, are recognized as disabilities if they are linked to a service-connected condition. I hope we're clear. Next thing you need to know, key factors and concept. VA treatment options. VA provides treatments for opioid addiction through intensive outpatient programs, traditional therapy, and pain management classes. Anybody in here been in pain management class? Put a PM in the chat for pain, a capital PM for pain management. If you've went through any type of pain management at the VA for your service connected or not, any type of pain management, put pain management in the chat. So we have our brother Jimmy Elmore that done pain management. And if you haven't put no, Jimmy Elmore pain management, J. Oliver, I guess pain management. Betty say no, she has not. If you haven't put no, because if you need it, we want you to get into it. Farm Girl Rebel say pain management. Henry A says pain management. San Diego Marine says pain management. Sean, no. And 66 Love say pain management. Then Alaska Night say no. Let me ask, for those of you that have said no, do you think you need it? Yes or no? Do you think you need it? Big Wheel, Alaska Nights, put in whether you think you need it or not. Sean, do you need it or not? Betty, do you think you need a pain management class to learn how to deal with your pain? Now, would you go? All right. Last thing, combine key factors and concepts. If you combine pain medication, now if your pain medication addiction is linked to a condition like PTSD, you may receive a rating for both. Come on now, did y'all know that? So if you get, if your addiction, your medication addiction is secondary to your PTSD, you can get a rating for the PTSD and the pain addiction. Come on now. Everybody show love. You said no. Okay, no. Okay, you don't need it. Okay. Question. If you are rated for a disability that happened years ago, can you grandfather a medication addiction prior to approval of primary condition? Now, you got to have the primary before you get the secondary. So I don't know if you're saying you're going back, can they take the secondary back? Because secondary is going to show if you can show symptoms. I don't know if you can backdate a secondary condition, if that's what you're asking. That is an excellent question, though. We need to, if you next time you talk to Raider HQ, ask him that, and we'll try to write the question out, because that's a good one. If they go back on a primary condition, service connection, well, do they have to go back on a secondary condition if you have symptoms? Maybe, maybe not. I don't know. Doc Shelley say, can't stay. Just wanted to say hi, brothers and sisters. So good to see you, Doc Shelley. Say no, you don't feel like you need pain management. Okay. Hey, Doc. Everybody speaking to Doc Shelley. Say we are doing VA drug punishment pushing. Welcome. Yes, indeed. Who knew that they was in the drug business? Now, Jalva say it will help with your claim development, and so if you do, if you go in there and do pain management, it helps. Okay, and join mental health and pain site better. Okay. Now listen to what we got here. Sean says, I've got so much chronic pain. I'm sure they got a program for me. Talk to your doctor. And if your doctor ain't doing it, talk to your patient advocate. Everybody show love to Dr. Shelley. I'm so glad Doc Shelley here. Just brings such positive energy when he in there. Yes, indeed. Jason M said, hey, Doc, shipwreck. Now you gonna call him a Doc, a shipwreck. What's up, Doc? Let's see. They ain't here, Sean. Always in pain. Prayer with you, brother. You need to talk to your doctor about it and take on some of them classes. Talk to your she'll be able to hook you up with your pharmacist, right? She'll be able to get an appointment with your pharmacist, which I'll say, I'm not for sure. Hey, what do they say, Doc? Say, thank you so much, Jay Oliver. I have an appointment on with my primary. Good. Same. Well, see, fam, we educate and help each other. Even last night saying, Doc Shelley, hello. See, he said he wasn't going to be able to stay long, but we glad that you showed up because you're always a blessing to the channel. Now, family, they keep doing both of them. I only copied one of them. I don't know what. The opioid crisis. Let me ask y'all a question, family. There's an opioid crisis in the civilian world. Do you think the pain medicines that the VA has given us causing veterans to be addicted? Huh? Do we have a crisis? If you feel like we have a crisis, put the word crisis in the chat. Is there a pain opioid, meaning medication addiction problem in the VA is not properly addressed? Do you think that do you think it's that bad or not? Or you don't know? Is there an over prescription of addictive drugs by the VA, or they're not properly given the right medicine? Do you and they probably not issuing it out right? Charlton say he think it's a crisis in the VA system. Okay. Now listen, Jal say the intake for the AMP active pain management program includes includes a mental health interview that mental health asks about your state and the PT asked about your pain. Okay, physical therapist. Is there a crisis with the medicine in the VA? What y'all just give me y'all opinion. So that's what I say. Is there a crisis with these pain medications? Or opioids, that's what the street name called. Of course, Jay Oliver said, Charlton said yes. Jay Oliver says yes. Betty Bob say crisis has always been that way for years. Okay. I want y'all honest opinion. Sean say crisis in both the public and private healthcare. This shocks me, family. I didn't think until y'all talked to me last time, I didn't know so many veterans had a problem with addiction to pain medicines from the VA. Seemed like they would address that. They are making it hard to get opioids for some people. That's not the answer. What do you think the answer is? Instead of not giving us the medicine, what is the proper way? Through pain management classes and educating veterans? They tried to change. They trying to, okay. Family, I've enjoyed this live stream. Y'all been so incredible. And listen, so you'll know that morphine is the medical name, is pretty much not too much different than the street opioid. All right, stuff they give you doing surgery and putting you to sleep ain't much different from the stuff that they use on the street. All right, from my knowledge, from what I know, you really think, unlike a drug pusher, the VA really cares if the vet kicks off, they save money. What do they do when a veteran overdosed? Do you think they tell anybody that the veteran overdosed on VA medication? They don't. You think they say something on addiction to it? for people that need them. Okay. So remember, morphine is the medical name. Let's talk about it. So when you're in the hospital, doctors, there we go, it's morphine, but out on the street, it's opioids. Now listen, Sean said approximately 1.1 million veterans are estimated to have a substance use disorder. Wow, a SUD. Of those, roughly 20-25% involve opioids. What? Thank you for the knowledge, Sean. I didn't know that. Now, that's why I need y'all here. Alaska Knight say, in order to stop epidemic, a lot of people get cut off. Oh, but you're in pain. So do you deal with the pain or you deal with the addiction? Why? That's a rough choice. So this is what I'm saying. Either you get cut off and you deal with the pain or addiction. Is that what we're dealing with, family? The pain or the addiction? Well, if we give you the medicine, you're gonna get addicted. We don't give you the medicine, you're gonna be in pain. Is that what's the solution? Narcan in every police car, it's a crisis. Yes, indeed. So which one you gonna deal with? You gonna deal with the pain or the addiction, family? Oh boy, I knew y'all was gonna answer. Come on now. But you're gonna get the pain out the way. You're gonna be a little addicted. Come on now, we gotta do what we gotta do now. Pain or addiction? Jimmy Elmore say pain. No, oh Lord, you're gonna be suffering. Charlton say pain. San Diego Marine say pain. Talk to your doctor about it. Betty about say pain. Y'all fear addiction more than y'all do the pain? Y'all more concerned? That's amazing. Now listen to what Brother Sean say. In 2024, 2025, over 75% of veteran opioid deaths involve synthetic opioids like fentanyl. I'd rather than the original prescription pills. Sean, not you too. You informed about this and you say you rather deal with the pain. No, Sean. Alaska Nights, please tell me you. Oh, no, not you too. You rather deal with the pain. You can manage the addiction some other way if it may not go to the addiction. Come on, fam. And nobody willing to come on now. That's rough. I'm the same way though. I'm a hypocrite because I'd rather deal with the pain than being addicted to anything. Why are you so much more concerned about being addicted than you are the pain? Pain can be very excruciating. Come on now, let's talk about it. Now I am getting my meds due. Okay, Job say he's gonna get his meds. Yeah. I don't like to see y'all. I'm depressed, Charlton. Yes. Sometimes you need it for a short time. Doctor, know how to cut you off. Okay. Pain. H-Town depressed now. How you know? Yes, I am. I don't like, you think I want to hear about y'all being in pain? I'm not doing this for show. I really care about y'all. Y'all come on here, man. I don't need to know y'all how we walk out of this addiction. How do we get out of this pill addiction that we just following the prescription that the doctor gave us and we not abusing the medicine, we get addicted to it? How are we going to walk out of this opioid crisis? Constipation, the worst, and put you in the hospital. Now, any of the medicines made y'all constipated. If you got constipated, put a C for constipation in the chat. I did. Because I was drinking all that water. Betty Bobs knew. She said, you drinking all that water each time. I was dehydrated. Oh my God. Now listen, I take ibuprofen for flare-ups and use a TENS unit for chronic pain, especially for the lower back. Okay, Sean, I hear you. Jimmy Elmore say constipation is the worst and put you in the hospital. I just read that. So he said, I tried to balance. Some days I can go without some meds. Other days I need it. Y'all are really, it seems like veterans do not want to be addicted to nothing. U.S. Army Grunt, excuse me, says I had a hiccup. After my open heart surgery, they gave me med for pain, but once home, the set of bags from the pharmacy. Hold on, let me see what you said. Give me a second. Once home, the set in the bag from pharmacy. I don't want to get hooked on the pain meds once one hard to get off. Okay, yeah. So you set them on the counter, I guess. Now I say, Charles to say, I've been in pain since 2003 when cold turkey. That's kind of hard to go cold turkey, but some people do. Like MRE cheese. Oh, it's constipating, boy. That's some rough cheese, ain't it? Now, family, y'all doing good. We gonna get to it there. Thank y'all for your patience. Now, listen. How we gonna fix this problem? It's the addiction plays a vital part in the brain. Now, listen. Our sister say, drink 128 ounces, make mango smoothie, frozen section, and bag from Costco will definitely be regular taste good. Yes. Mango. I love mango. Yes, indeed. Now, listen, family. What do we do to treat this? What are some of the treatments for addiction to pain meds? Huh? Let's talk about it. It's affecting your brain, your body, withdrawal. Have you ever heard of this here? Dipropanomorphine. The dip morphine, that's one to deal with the withdrawals, I'm assuming. Also, narco. Who heard of narco morphine? Y'all say is this the one the police keep in their car? Is this the one the popo keep in their car? Now listen to Farm Girl Rubber say, I will take it in a smoothie. I'll take it in a salad. I'll take it straight out of the fruit. Best fruit ever. Wow. Morphine is dope. But that's legal stuff. That's that legal stuff. You won't feel your toes, Charleston. That's what you get at the hospital. They doctor give it to you, so it's okay, family. We get into the hard question now. Morphine makes me not breathe. No, that's not good. Family, if a person struggling with an addiction, if you have to choose between, let's say if it's a cigarette habit, a drug habit of some other type, if you had to choose between the medication and its side effects or the addiction, what do most people choose? Because some of the medication has addictive properties. Morphine makes me not want to breathe. Wow. Think about this, family. Here we go. Opioid overdose treatment to keep people from overdosing on opioids. And, our brother said it earlier. Now, listen, Betty says, Farm Girl Rebel, that the emergency room bag, that's the emergency bag. If you can't get the fresh fruit, mango, yes. So you get it all in that freezer bag. Now listen to Will Win Big says this here. Alaska Nights. The FDA has approved over-the-counter Narcan for opioid overdose reversal. The life-saving drug will soon be available in drugstores, convenience stores, grocery stores, gas stations, and online. Let me ask you, is that thing like that Accupene injector? They used to stick in our leg if we was exposed to chemicals, they told us to stick in our leg. Is that the same stuff? And where do you stick this thing at? I'm nervous. Say, Farm Girl Rebel say, it's great. It's a great idea having frozen mango in my freezer. Should break out the blender. What do you put in it, Betty? Okay, yeah. I'm learning. I'm being nosy. I'm being hustling on Nathan. Oh, boy. Now, that's one thing. You say Narcan goes in the nose. Oh, Lord. Okay, it's a nasal spray. Okay, I thought it was a needle. Now, listen, behavioral therapy. Who in here have ever had behavioral therapy? You can use that when you have pain addiction, when they're trying to address the behavior, and a therapist or somebody helping you go through that. There, behavioral therapy is one type of treatment to help you with, and the other ones would help you withdraw the Narcan and everything. Let's talk about it. Behavioral therapy for it. Now listen to what our brother say. Since Brother Charleston say since 2003 had CDL, had to take drug tests. If I pissed hot, would have lost my job. That means you were positive for drugs. That's what means pissed hot. For those you don't know. Let's see, work at a job and support my child or give up. Wow, heavy. There's behavioral therapy out there. If you have any type of pain, drug addiction, or any other type of addiction, the VA should offer it. All right? Help, okay? Helpful when you need help. Help therapy, self-help therapy. And they have groups that help you cope with and deal with the addiction. When you by yourself, you can go to a group and that gives you self-help tips and everything like that. I've never been the one. I haven't been addicted. Family, so we covered it tonight. Pain meds and the risk. Let me ask you this here. Is pain medications, okay, don't give me a second. So my question to y'all, are pain meds too risky? Are pain meds too risky or not? Yes or no? Put a yes in the chat or a no in the chat. Now listen, our Farm Girl will say, I quit cigarettes in 2003, but picked up vape, which is marginally better, but still an addiction. Who in here, when the last time you've had a cigarette? Let us know that too. But do you think the pain meds are too risky? Pain meds are too risky, but are definitely needed for some. Maybe. Charles say maybe. Okay. Betty say maybe. Look who's in the room. I'm in the background. I'm just listening to the smooth sounds of H-Town. Come on in, bro. Bro, can you just, if you're going to say it from the chat, everybody show love to Raider. Raider, we need your help on this thing. I want to ask that question y'all asked earlier. If you never go over there and ask him, if you can't ask him here, but you definitely welcome to come up, brother. Somebody asked the question, okay, so, and I don't want to mess it up, that if, let's say, their condition goes back 5 years with their back pain. So they get a condition, a primary service connection, and they've shown symptoms of the secondary condition. Let's say, the side effects, a secondary condition. Can the secondary condition go back with the first condition and you get back pay for a secondary condition, or you cannot get back pay for secondary conditions? Let us know. Now you said sure to what? You let's see, you say long term. You answering one of their questions Oh, what's up, brother? You want to come up for a minute or what? Let us know. Betty Bob say 21 likes and 17 watch. So good to see you. I was busy, but I saw you over there handling your business with your teammate over there. That was really good. Y'all asking them questions. I appreciate you always asking questions pertinent to the veteran. I appreciate you. Now, Alaska Knight says, Raider HQ, hello. Sure. Say, so I don't know what you're saying. When you say sure, because you said you're going to sit in the background, but you know what I'm going to do, Raider? I'm going to just send you the link just in case you saying sure because you might come up. If you're not pressured to come up, brother. But I always try to show you the courtesy. Okay. Because this is a subject, brother, that I've never been on drugs, I've never been on drugs, so addicted to them. So I don't know. I tried liquor and I couldn't. I wanted to fight everybody, and I was only drinking wine coolers. So family, y'all better thank God we got a few minutes that our brother is willing to come up here and talk to us. Let me see what I got here. I'm copying it. All right, man. This, and I appreciate you. We won't hold no longer than you want to be here because I know you busy. This man got life. He got a business. And let's see here. Give me a second, y'all. Oh man. And Alaska Nice to send me such blessed information. We got stuff to cover for the next week. I'm about to get that to you right now. Let me see. Man, I thank y'all because y'all, I didn't know, this is what threw me off, family. So many of y'all said that y'all had some type of addiction to pain medicine. I just didn't know what to say. Let's see, I'm gonna put you here. Okay, hold on. Give me a second, right? I'm seeing you the link right here. Okay. I just sent it to you, my brother. Oh, this overwhelming, family. Yeah, that I have to be honest. Charlton say it made H-Town depressed. Yeah, there's no, because I don't know what to do for y'all. I sent you the link, brother Raider. I don't know what to do, family. I don't know. When y'all told me on the last one how many of y'all have been addicted to pain medications and it's VA related, is there an opioid problem? Excuse me? And the VA is, I was assuming when the VA addressed it, they're talking about on the outside. There's an addiction problem with VA medication? Hold on, brother. Yeah, brother and sister, I got to get my brother right up. Because I'm in a distressed state right now. Everybody, I want y'all to show love to our brother Raider. Welcome to the channel, brother. I don't know what to say here tonight, man. How you doing? Tell us what's going on with you.
Oh, I'm just a little tired. Just a little tired, that's all.
I was surprised the video was so short earlier. I thought y'all gonna put out a whole bunch of stuff, but y'all answered some good questions. I like that. Now, what's going on?
We didn't get to enough questions, but that's all right.
Yeah. So, brother, what is that? Is that? We're talking about having what do you call it? Getting service connected secondary for pain. Pain medicine, being addicted to pain medications. And let me pull this up. And so, this is something that came up. I want to say almost by accident. I just asked the question, and I was so shocked that so many people, and that's the let me get this right here, bruh. So many people saying that they service-connected disability, that they're taking medication. It's on the screen now, and it causes them to get addicted. Have you ever seen someone file a claim for using the interim step of pain meds, like you would use weight gain, to get a secondary service connection for addiction to pain medicines or sort?
I haven't actually seen pain meds used like that. And that's a very interesting topic. Mostly because typically the intermediate step is a bridge that says this disability indirectly caused that disability. And if you were addicted to pain meds and that those pain meds caused you to potentially fall down the stairs. I mean, I've been using fall down the stairs a lot, but
yes.
That's the kind of connection that, in my opinion, you'd have to make. Like, you would have to have a correlation. Like, they'd have to be showing maybe like cirrhosis. Well, I don't know if cirrhosis of the liver. It's a very strictly medical argument. Like, you'd have to make a very, very complete medical argument to associate that. Now, mental health, I've seen mental health symptoms due to addiction that I've never seen it due to pain meds be service connected. But
are you saying that it is possible, impossible? Because they saying even if you dealing with like PTSD, that if you do people take pain medicines for PTSD? Because there's pain associated with PTSD.
Not pain meds, but like there's what is it called? Ativan, or they're addictive psychological medicines that are very that can be addictive. So, I mean, there's that, but in my mind, I don't have a complete thought on this, but in my mind, I believe that the rater would have trouble service connecting abuse of medications, because that would fall under kind of a willful misconduct type thing. Because alcoholism is a coping mechanism where, you're not prescribed alcohol. You just take alcohol and you abuse alcohol, versus you're prescribed a medication and you're scheduled to take that medication this often. And, naturally you may become addicted to it. And then you stop taking it as prescribed. And that might cause some issues. I'm not fully 100% on I haven't formatted all my thoughts on it, but I think it might have something to do with, because you're not taking the medicine as prescribed, the VA is not on the hook for that disability caused by that medicine.
Oh, they're going to try to weasel their way out of it.
That's obviously don't hold me down to it, because I've had a little bit recently of people listening to what I say and taking it in a really weird context, but I haven't formatted my whole thoughts on it. But yeah, that's kind of my provisional assessment of what would happen.
Okay. Farm Girl Rebel is on the way out. She said, "Hey guys, I'm got to blow out. I have a raging headache behind my eyes that just isn't going away. Love y'all. Have a good night and week." She took medication prescribed by her doctor. Yeah. That she felt like something was crawling on her legs, and she was, I forget what it did to her head, like it was electrodes. So if you take medicine and they have effects on you, let me put it to you like this here, brother. All right, now I helped a brother. He was having trouble getting claim approved. He had dental work while he was in the military. And the doctor put in his notes, this could cause sleep problems, depression, and different things. And we was able to get him a combination of 40% because of the side effects of the medication. So you saying there are certain medications that you can get it for and certain that you cannot?
Potentially, yeah. There are addictive mental health anxiety meds, like very addictive. So it all depends on what the medication is, how likely it is to cause you to have, some kind of addictive tendencies towards it. But yeah, I mean, it's a challenging question, to be quite honest with you.
And then say, from Girl before she left, she said, "My big brother became an addict, scared the hell out of me, would never touch them after witnessing this struggle." And I don't know if people say, well, maybe you have a genetic predisposition for, like, let's say somebody say, "Oh, do your family have a history of drug use if you do become addicted?" Are those type of questions that a rater would consider?
No, because that would be hearsay. So it would depend on what, like, the context of it, like here's actually this is the closest thing I've seen. Somebody, it's a term called gorked, where they over medicated somebody with drugs, like pain medicine and whatnot,
Yes, sir.
morphine, whatever, and they gave them too much for their weight, and
Hmm.
they ended up trying to get up. They had a bad reaction to it. They tried getting up, fell down, broke, like hit their chin, broke their teeth out, type thing,
Hmm.
like, or hurt themselves that way. That's a situation in which that's no fault of the veteran, right? Like that's not abuse of anything. That's, you were given those meds, and those meds, you had a bad reaction to them, and you know, bada bing, bada boom. Indirectly, you get a disability because of it. Fall down, break your elbow, something like that. That's fine. Like that's fair play. But if it's a progressive thing over time in which the veteran, because I've worked on the VHA, I don't I don't like how the VA personally deals with pain meds, because I had significant pain in my shoulder, my service connected
Okay.
disability, and it was like night and day. On the military, they were giving me Percocet, Vicodin, like all this stuff, like crazy, to where the point where I'm like, I don't need this much. And they gave it to me in like in a baggie, like in a
Yeah.
sandwich baggie. Like it wasn't even like in a bottle or anything. It was just like, here, pop some of these. And then I go to the VA, and the VA's like, here, have some capsaicin and put it on your shoulder. Have some cayenne pepper and put that on your shoulder. And I'm like, I'm in so much pain that I want to rip your throat out through your eyeballs. And you want to give me cayenne pepper for my shoulder pain,
Lichen and
right?
patches.
If- I had a dislocated shoulder, and I'm like, I will harm somebody. Like, see, I'm kind of a jerk sometimes, because I was in the ER, and I'm like,
You know better.
yes, I am drug seeking. I am drug seeking. Yes, arm is dislocated. I am drug seeking right now. Yes, yes. The answer is yes. Yes, I am. So we can put that to bed. Now give me my drugs, please. Like, but yeah, I don't know. I just find that it's very challenging for to get medicated for anything these days, because the pendulum has swung the opposite way, to where they don't want to give you medicine for anything.
This is the thing. And so, so I'm going to say, H-Town, I am on 3 different BPs, meds, and blood thinners. I wonder what BPs are.
Blood pressure meds.
Blood pressure meds. Okay. Not counting other meds, side effects is the big consideration for me.
Mm-hmm.
And I mean, if they're not willing to give what we need, say my service, let me see what y'all say. My service connected PTSD that I am applying for was helped back in the day by my pain meds back in 1999 to 2003. Like a zombie, no worries, no anxiety. Do you get what he's saying?
Yeah. I mean, there's something to be said about pain meds to the point where you can't feel pain. That's bad. You should always feel some pain, because that's how you can tell if you're overdoing it, right? If you're completely numb, because that's why I have a permanent disability in my right shoulder, is because I was completely just, and they're like, all right, go over here, stack this, get ready for deployment, do this stuff. And then they caused me, like, by the time the meds ran out, my shoulder was Swiss cheese. Like it was just, and then I felt it, and oh buddy, did I feel it. And so there's a fine line. And unfortunately, that fine line requires actual medical providers to monitor your pain, to be engaged with you, not to be disconnected for 6 months and just be like, good luck, everyone. See you in 6 months. And it's like
6 months. That's when my doctor say they want to see you. 6 months.
And so it's a complex problem. There's no waving a magic wand and fixing this, unfortunately, because I can see both sides of it. I can see the challenge of Sometimes providers would hand out too much medication between the Army and the VA, and then oftentimes they don't want to hand out any. And if so, yeah, I don't know.
What's a happy medium?
Well, the happy medium would require actual pain management. Like
we talked about that earlier.
Yeah, like actual pain management. Some places have really good pain management clinics. Other places in rural environments do not. They simply do not. The veteran experience is not the same across the board.
Did not know that.
Yeah. Geography matters. Not all, like satellite clinics don't have the same services, staff as other bigger clinics do. So go ahead.
What role should the pharmacist play in pain management?
I think they should have a more robust conversation about it. I think that they should have feedback. Yeah.
They should have, should the veteran, or they should come talk to the veteran or the veterans, or that's just asking too much for them to give insight. To say, I want an appointment with my pharmacist. Is that asking too much?
What's funny is sometimes pharmacists can be providers in the VA, like treatment providers too.
Oh, really?
Yeah, they can. Like I worked with a mental health pharmacist. It was hilarious. Like we would razz them so much about it. We're like, man, can I get a Tylenol? And like just mess with them all the time. But I think that it would be better if the doctors who prescribe the medicine if the pharmacist was included as part of your treatment team more often.
Okay.
That's what I mean by it. But yeah.
I'm listening.
Oh, no, I think that this is a very powerful, very good topic because it's not one size fits all.
No.
And it can't be.
All right. Did you hear about the veteran groups demanding swift passage of the bill that requires written informed consent before certain drugs are dispensed? So, and I'm wondering, they say informed consent from the veteran, I'm assuming. And this is something else here.
Why?
They want, I don't know. It's saying the organizations, American Legion, DAV, and Veteran Foreign Wars, and
the drugs risks. Okay, I see where it is. That's not a bad bill based upon that statement. Basically notifying veterans of the risks of the drugs that they take.
But they do that in writing.
They should do that in writing, yes. Well, whenever you get a medication, it's in there. What the risk factors are, all that stuff, yeah.
So what are they asking for now?
I guess a formal letter. But here's my problem. If you go to the VA for your care, they have a drug scheduler. You can only get drugs from that drug scheduler. If that drug causes you to be harmed, if that drug has negative side effects, what's your recourse? You can't say, I would like the alternative, because there is no alternative sometimes. Like, I'm living proof of that. They wanted to give me a medicine that doesn't help me with my medical condition. I had to go through the outside Champ VA to get the medicine for free that my doctors have said, this will help you. This will make you feel like right as rain. You won't have any more, like symptoms. And
look, you giving up too much information, because that people already know. Champ VA, that mean they both 100%. Now they really gonna be hating on you.
Yeah, and that's true. I mean, but it's true. So it is challenging. Me and my wife.
Do you like Do you like the Champ VA system? My daughter experienced it because I didn't experience it. How do you feel about Champ VA?
Well, my opinion is highly biased because I get the meds that that if I didn't have Champ VA, that'd cost me, $1,000 each time I took it. Right. So I love it.
each time you took it.
Yeah.
My God.
Yeah. Each time I took it, that's how much it was going to cost me. And then Champ VA made it free. But if I go to the VA and get my care, they won't give me the same medicine.
No, they won't.
And that's not true for everything. Like a lot of things, the veteran does get the exact same medicine as the civilians, but it's hit or miss, right?
Mm-hmm.
But let's be honest with ourselves. We don't get the full spectrum of what civilians get. Civilians can get whatever medicine that the doctor feels like the insurance will pay for, and the best one at that. We don't get that same courtesy.
Is that because they have a limited amount of medications that they can offer us, or is because it's a government bureaucracy? Everybody so love the big blue. Say, I have a pharmacist that is available to me at my VA clinic. She is fantastic. I did not know that. You can talk directly to them. Go ahead.
Oh, yeah.
Brother.
Yeah, you can.
Wow.
I mean, I don't know. I send the question one more time because I think I forgot it. Oh, whether or not the government is a bureaucracy thing. Is that what we're talking about?
What makes it hard for you to get the same medications from the VA? Is it because of the bureaucracy? I kind of asked that I read something. Sorry about that. Or is it bureaucracy? Or in Champ VA, you have more options. Do they have the medications at the VA, or they only have a certain number of medicines that they approve of? Talk to me.
That's what the pharmacy scheduler is. It's certain medicines that they have approved of, and it's not the best and the brightest. It's not the highest quality medicines. Okay, it's whatever they feel like, and it's the federal government. If they wanted to put us on like AAA, level medicines, if they came out with new treatments for certain Gulf War illnesses,
yes,
I say pay the money. Pay the money.
Don't get off of it.
Because
Because what? Go ahead. Because what?
Well, the thing and this is my personal opinion. So, and I've been having to say this a lot more often. This is my personal opinion, is that there seems to be a missed opportunity to prevent disabilities from cascading out of control and getting drastically worse. Take diabetes, for instance. Okay. There is no early prevention of diabetes. They just wait until you got full-blown diabetes, then they start treating you.
That's horrible.
And where the civilian side, they're preventative. They'll put you on medications before you get officially diabetic. And then that way you don't get full-blown diabetes. They use it as a preventative. For whatever reason, the VA does not overtly like to be preventative. They like to be reactive. They like to say, okay, how bad is your thing? Yeah, let's let that go a little bit further. Oh, shoot, now it's that bad? All right, let's start getting some meds in you.
That's hustling backwards. That's hustling backwards.
It's weird.
And my question is, why do they have all of these groups that they offer? So they got different ones. Thank you. I think Brother Charleston sent this to me. They got groups for dealing with heart failure groups, pain groups. So we need to learn more about these. Do you think things like this would be helpful? Healthy liver?
Yeah, that's kind of a wellness guide. Those are wellness groups that are meant to educate you about how to live on your own. And then I always put a comma in my brain and then go, because we're not going to be there for you. I hate to be like that. I hate to be like that, but that's how I feel. And that's my truth, right? Like that's my truth. That time and time again, it's like that meme about, leadership let me down one last time into the ground type thing, where they're carrying the coffin. I feel a little let down.
I do too. I do too. I'm going to cut you off. Go ahead. No, I was just agreeing. Go ahead.
I just feel like wellness groups are a great step. Don't get me wrong. I'm not saying that they're not. But it's not an interactive experience. It's them talking at you, telling you how to, like, don't drink soda, don't do this, don't do that. Okay. But for me,
like Ronald Reagan's wife, Nancy Reagan, just say no to drugs.
But for me, though, like, okay, can I get a little bit more one-on-one kind of help with my disabilities, with
like
my diagnosis? Yeah.
Like they do with weight management?
Well, weight management is a little bit of a joke. The MOVE program, I mean, that's fine if you live 10 minutes away from the VA medical center. But if you live an hour and a half, good luck.
I never thought about that, fam. That I guess I live away from, but I got a tollway right by my house, which right next to my neighborhood. I could walk to it. So I didn't think about people that are in rural areas. They're kind of being discriminated against because they don't have access. And I was assuming and was kind of making myself feel better, say, well, they got the clinics out there. They should be okay. They open up clinics in these areas.
Yeah. Until you're not. Like, I mean, you're only, like, you have access to whatever you have access to. And that's why sometimes being a VA employee on the VHA side, you're just doing the best you can with what you have. And sometimes wellness groups are all you have. But you know what just drives me absolutely nuts, if I could just take an aside here? Have you ever noticed that the interns that help you are 1,000 times better and more willing and more wanting to chase things down than the seasoned people that work there?
Yes. Yes. Mm-hmm. Go ahead. Yeah, because when I went to get my dental work, this doctor was boom, 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 getting everything out the way. And he said, oh, we'll pull both of those today. We'll do this. And I said, where's the doctor? Oh, he was just doing the intern. He went on somewhere. I said, oh, where's that passion at like that,
Exactly. And I've had that in my own personal experience. I've seen it while working at the VHA, is that people that, they're excited because they want to be there. And then you have some staff members that don't want to be there. That whatever reason they're there, it's not because of you. It's not to honor you. It's not to, and I get the fact that, because I've been on both sides of the fence, some veterans are jackasses. Okay. It's just you sigh when you see them because you're going to have a miserable time, because It just is what it is. It's like with the human race, you've got good people, you got bad people, it's a complete spectrum of demographic. But I had one doctor that's like, oh no, your symptoms, they're just this. Just, you know what? Go out and run a little bit. You'll be better. And I'm like, yeah, you know what? I'm going to leave the room now before I catch a flag on my VA chart for violence. Tell me to run again. And then I get this nurse, or not a nurse, but I got an intern, and ran a whole bunch of blood tests, found my diagnosis via, like, legitimately. It's not like we're going, okay, wink, wink, he has this. It's actually, I've got my, diagnosis now. We can prove it. We can show it. We understand why everything works now. But it's not generalized. I really wish you could get that. Like, if doctors were paid based upon the outcomes, right, of how like, when you go out into the civilian world, every time they see you, that's money for them, right? So they're happy to see you. They're happy to get this. Oh yeah, we'll order those tests. We'll do that. I kind of wish that the VA would go to that, so that way we might get a little bit more. Can I please get an X-ray? I shouldn't have to fight with my doctor for an X-ray.
Brother, when my daughter was using Champ VA. That's why I say somebody's saying that, it's better on the civilian side. Yes.
Yeah.
There was a waiting list for to see a doctor. So, the person says the waiting list. Okay. I said, okay, well, we'll do something, fill out whatever you need us to. And then once we wrote down Champ VA, they said, oh, Champ VA? I said, yes. You didn't tell us that. I said, I didn't know to tell you.
Front of the line, sir.
Should we feel horrible that they put her to the front of the line? She was seen whenever, as soon as she needed to be seen. I'm like, man, what is this? Some kind of government insurance VIP pass or what? I don't see that's a problem, but I'm gonna tell you, when I went to, I've noticed the difference. Any questions, fam? We have to after party because Raider can't be here for so long. So any questions, we have to after party. Let us know if you got any questions. So Raider, I went to Methodist Hospital when I had to do a procedure because they didn't offer it at the VA, the specialists at Methodist, and I was treated in such a way that when I came back to the VA, I just felt like I was coming back to like the wasteland in the Terminator. And I hate to say that, it's just that when it comes to the attitude of some of the people. And when I went there, I was like, you know what? And I was, because they say, well, go back and get the medicine from the VA. You know what this and that. I say, you know what? When I talked to them at the VA, I say I was treated way better when I was over there. I can't stand the way y'all sitting veterans through hoops sometimes. But go ahead, brother. Now, any questions, my friend? And my friends here, Raider HQ say, Betty say, Raider HQ, that is all true about the civilian side with insurance. Yes, indeed. Now, do you think we need to lean more toward community care or improve the VA healthcare system that we got?
Well, I mean, I think it depends. Once again, it's not a one size fits all. You've got some people that live in areas where there's a saturation of good VA clinics, VA doctors. You've got other places where there's not as many civilian doctors. And opposite of that, so I think that if I could, it's kind of like the starting of a thought on this topic. I think that you would have to go with itemized resource lists for each area, major areas, and what are the vulnerabilities. Do a cost benefit analysis. See where, if veterans lived here, would they have all the same services as other veterans? If veterans live here, do they have the exact same services? If not, how do we bridge that gap?
They don't have anybody that does that.
I mean, they might,
patient
but
advocate.
No, a patient advocate's not for that. No.
Okay. Now, our sister say right here, big we'll win big. This is Alaska Nights. What do you think about the 75.5 days average VA claim process? And brother, ask them. I got to make a little quick thing. You're gonna be the host for a minute. Take over my channel. You're gonna make it yours. You get all my subscribers. You get all of the perks. You get the groupies. You get it all, brother. I'll be right back. Thank you. All of it.
All right. So what do I think about the 75.5 day average VA claim process? I mean, I'm a little biased about it. I think that sometimes you can only cut so many corners. Like, you can't bake a cake in 2 minutes. Some things do take a certain amount of time. And no matter how much you streamline a process, there's going to be a minimum amount of time. I think the 75.5 day average is about the minimum we can get to. Certain steps in the process require there to be delays. And if the more you start cutting things down and speeding the process up, the more that you can invite for top sheeting or speed related errors. If you push somebody really fast, because being quick and being efficient are not the same thing. So if you have, it's a balancing act that needs to always be in everybody's forefront of their mind. If you're doing something quickly, it doesn't mean you're doing it right. And whenever I was rating, I would go slower. Now, could I go really fast? Yes. If I needed to, I could go really fast and still be efficient. But the reason why I went slower is because I wanted to take the time to not just look at what was in front of me. I wanted to see, are there any errors that could benefit the veteran? Was all the evidence put before the examiner? You know, things that, like, most of the time, from my observations, what I have seen is that a lot of the time, certain individuals would look at the medical opinion, what box is checked, it's at least as likely as not or less likely than not, and then they would deny based upon them looking at a checkbox. They didn't read any of your evidence. They didn't read why you were trying to service connect it. They didn't read anything. They just looked at the checkbox and used that checkbox to determine the outcome. Even if, like, you were to be denied, it said less likely than not, and they embedded a positive medical opinion for a different theory in there, that RVSR didn't read that a lot of the time when they're going really fast. So in my opinion, how fast things go is not as important to me as how, like, efficiently they were worked. I'm somebody that had to wait 3 years for my shoulder exam. 3 years. Okay. Back in the day, I had to wait 3 years. I think to some degree, we're throwing the baby out with the bathwater when it comes to how fast we're doing claims. I wish we would take these and do them right the first time. How do you guys feel about that? Do you feel about, like, doing it right the first time?
So you saying quality over quantity?
Exactly.
So the fact that they had that problem, not picking on you, Charleston, in Pennsylvania, they put quantity over quality, and what was the result, bro?
Having to do even more work than you originally had to do. Now you got to re-rate it twice. And that saved nobody anything. And here's the thing. You know, you can brag about, we helped, 17 million veterans. We did 17 million veterans claims. Okay. But if a veteran got denied 5 times and then the 6th time they get granted, and there was nothing different about any of that other than somebody didn't do their job right, why did we have to do that 6 times? Why didn't we just do it right the first time?
Yes. So you see that. So I wish you could talk directly to Secretary of the VA Doug Collins about this, because they had a key, and we're going to go over that video. I'm trying to think of, y'all know the senator I love. I think he's Japanese. He has a Japanese name, and he's Japanese American. And when they were just talking and, we getting them done quick, he say it's more important to have quality claims, and they started talking like him than quantity. And he broke it down what we've been saying the whole time, what you're saying, and all of the other congressmen started talking like him because he was right. Go ahead, brother. I can't say his name. Go ahead.
Yeah, I want to say Tekashi 6ix9ine, but I don't know why I want to say that.
I want to say Tekashi, but then they're gonna call us racist. But look,
I don't know.
I'm about to say Tekashi. Tekashi should get out of my head. He's a snitch anyway. Listen, not the senator, but listen. What you saying, brother? Go ahead.
I was just saying that. So here's the problem. It's not like a lie, but that's how when somebody lies, they've got to keep the lie going, and they got to keep it going, and they can't change course, because once they change course, it looks really bad
for them.
For them
and their leadership.
Yep, and their leadership. So unfortunately, doing more claims, that's the standard, because if you don't do more claims, then you did less claims, and you're not important. You're not good. That's not good. So this is the metric that they're using. This is what we're saddled with until maybe the next secretary decides to take it a different way. But there's no chance that this actual secretary will slow down on claims unless he has to. I mean, that's evidenced by whenever those 38 CFR 4.10, whenever he tried to change the rating scheduler without giving the question thing, One of his complaints, one of his big complaints was that would cause 350,000 claims to have to be re-adjudicated and so. He was more concerned with slowing things down and having to retrain people than he was with it being done in accordance with the case law.
Now, Alaska Nice, I'm going to get to you, Brother Jason. I'm going to get your statement, but let me get to hers. It's kind of related to what she's saying. She said, Alaska Nice, a.k.a. Big Will Win Big, say they are able to pull several claims with one or two items so their score goes up.
Oh, yeah.
Is that a thing? Oh, you going to agree with her?
So your coach assigns you work. Now, typically, whatever you're assigned, you should be able to clear that same day, right? If you got 5 claims, you should clear 5 claims that day. But like, let's say they put 8 in there. Now, you get to prioritize your queue however you want. There's a certain number of days that the claim's been on station at the regional office, and that typically can't go above 5 days. So yeah, whenever people triage their claims, they look for the quick and easy ones. Where are my quick points at? I'm going to get some quick points. And that's what the 1 and 2s are, is they're quick points. They don't take long to rate. They don't take long to review, because there's a certain amount of time that it takes you to review all the critical things that you need to review. And no matter what, it's going to take you that minimum amount of time to do it if you're doing it right. And then on top of that, then it takes you a certain amount of time to work each individual condition. So if you have a low number of conditions, then your overall time to points goes up.
And that's a good thing if they're doing it right. Yes. Yeah. Now, Charlton say, yes, my new community care provider treats me like a king, H-Town. Now, Jason, I want to get to your issue here and tell me if you understand what he's saying here. The VA is not paying for the community care bill on time. So what do veterans get a bill and threat with collections? Is that happening?
They shouldn't be getting that. But what happens is there's this trap where they're like, oh, you've got to give us your other insurance. And it's like, nope, this is a service-connected disability. I've even given up to the point where I've given up all other insurances except for Champ VA, because I'm not going to play the game anymore. Because if you have a different set of insurance,
they're going to try to pull it.
They're going to try to pull it, and they're going to try to bill it, and they're going to try to do stuff, and then that's going to cause a bad thing, because these are service connected. Or if you're 100%, then everything's connected. The VA pays for everything. But the VA also gets reimbursements from insurance companies for treating you.
Yes, because they sent me a statement when I had that procedure outside the and it wasn't a gender change or nothing, just letting you know. But I had this procedure. If it did, yes, they called my niece don't call me Uncle P no more. She called me Uncle Peaches. Now listen.
Peaches.
Now listen. So, yes, indeed. But so they sent me a thing saying this is not a bill, but they billed my insurance from when I was teaching. That's wild. So that's amazing. Go ahead.
Yeah, I mean, it's just a truth. It's a fact. It's I don't know how to. The VA does things, right? And I don't know what to do about it. They do things and people don't believe. Either you believe it or you don't. I'm at this point now where you can only teach people so much before you just got people that won't believe it,
And don't pay the bill, because the VA is supposed to take care of that. If you're service connected for that, and especially if you're 50% or higher, it covers everything but dental. Provide VA healthcare. This is for Brother Giallo. Provide VA healthcare. My hospital knew why cannibalized is to please Dougie and the Get Fresh crew. Okay. Yes, and do Dougie, what's his name? The rapper Dougie Fresh. Oh. Now listen, Raider, how are claims getting rated in 3 to 11 days, all are being denied. Who doing these claims, AI or humans?
So, okay.
Betty Bobs.
So I have had somebody get rated in 6 days that got a positive benefit out of it because it was a missed issue. So I did help somebody with that. Now, you should not be rated in 3 to 11 days if you filed a fully developed new or increased claim, because they should have to wait 30 days total before they can rate it. Now, the reason why is because VSRs are basically seeing, do you have element 1, do you have element 2, do you have element 3 for the claim? Okay. Do you have a diagnosis? Do you have an insert? Like, what theories are you claiming? Do you have everything? If you show up and you don't have a diagnosis, that claim instantly goes to a rater. That rater instantly denies it, and then the authorizer, adjudicates the award of nothing. And the regional office loves that because that's getting them quick points for the regional office.
Incentive.
Yeah, because they don't want, like, rather than the rater taking like 5 hours to do it, maybe they only do 4 claims today. If the rater finishes and completely adjudicates 10 claims today, then the regional office gets more points that day and they're happy. It's kind of weird.
Okay, now, well, he say, Jason finally passed the Dougie side. Yes, indeed. I am on Medicare. So Medicare, all these falls into it. Brother, let us know how everything going with your new endeavor. Your when y'all take here, we're gonna call you the Three Amigos, handling your business. Is it what you expect? And am I asking too much to say, do y'all use AI at all? Or is AI just a, and is it any harm? Is it any harm in using AI?
Oh yeah. Okay, so I got to be careful on how I say this because I said I wasn't going to be mean about it. So far, people have presented their AI to me and said, "Hey, look, can you try to break this? It takes me about 2 seconds to break it." I've even reviewed claims and where I found clear and unmistakable errors or things like that, and the AI missed it. So I've reviewed so far like 2 or 3 different AI programs, and it's good for new claims, increases, secondaries, stuff like that. It's not new for determining what laws and rules and regulations were true at the time or how they're supposed to be interpreted.
So they're not good for appeals.
They're not necessarily good for appeals. Now, AI is also not good for when something new happens in the VA and then you want to figure out whether or not it's a good thing or a bad thing as to what changed in the VA. It is not good that you go to ChatGPT or whatever and type it in and then listen to a computer to do the thinking for you. If you are the thinker, it is a tool to help you think. If you are getting your opinions from an AI program, that is not how it is intended to be. And there's a lot of danger associated with that because those things hallucinate a lot of the time. Like we've seen it to where, we talked about that. So, sometimes the best of intentions, right? The road to hell is paved with the best of intentions. Using that tool and going, wow, it says it's a great thing. Like, I find it exhausting.
I feel like it's no accountability with the tool itself. No. Any questions dealing with AI and rater them and how they doing things on their side of their helping veterans with their claims. Because let me ask you this here, brother. What can you what can you do that you feel that AI is limiting in doing? Is it supplementals or anything?
Clear and unmistakable errors, because clear and unmistakable, it has to be clear and unmistakable to the human, right? The AI doesn't really grasp what is clear and what is unmistakable. Higher level reviews. because the AI program likes to use the law, it falls on deaf ears to the higher level review. Supplemental claims, same thing. They're like, it writes out this thing. And I'll be honest with you, do not be the person that has a Nexus letter generated that you take to your doctor and have your doctor sign. Don't do that, because number one, the rater can tell. Okay. The tone of the thing is robotic in nature. You did not graduate Princeton. Okay. Like I'm not going to say, I mean, some people might have, but a lot of the time, the way that it writes it up is not the same as the language that you've written up in previous things. So we can tell the difference, because that's what raters do all the day, is they read and they can tell who's writing what. Because of the internal tone of the thing, the words that are chosen, how highbrow is it? What are we talking about here? And it's bad, because if you have your doctor sign something that they don't believe in, right? That they didn't come up with themselves, what does that look like to you?
Plagiarism, right?
Yeah, it's not a factual thing. Right. So I just say use caution with it. Make it be a tool for you. Be the thinker. Don't let the thing do the thinking for you, because you're going to be in trouble. Okay.
Okay. Let me ask you, when you're doing things and y'all working on the process you're doing, what are you bringing to the veteran community when you're helping them with their claims that you felt like this was necessary, that is veterans it's not being addressed when it comes to veteran getting help with their claims? What do you think what 2 or 3 things you felt like this was a problem that we can come in and be supportive and help veterans? Is it the speed of it? Is it getting things clear up front with how to file the right claim? What is the biggest thing you've seen that has been solution oriented in what y'all doing?
That's a very good question. And I'm going to be honest with you. My first instinct is to say something that's going to be pretty damn mean. I'm not playing, like not towards you or anything like that, but
I'll cry off camera, but speak it.
I find that you don't know what you don't know. And that's one of the things that I think that we can bring to this equation. Because if the veteran community had a clear grasp of how the VA claims process works, there would not be as many denials.
I agree.
There would not be as many situations to where people are genuinely confused, to where they're like, wait a minute, I don't understand why, but 38 CFR so-and-so says this, and then they get denied again. And then the higher level review gets denied. I've never seen an environment where people are the most trusting of people who have never worked the job before.
Yes.
Now, I understand that there are bad people that, not everybody's good at their job or anything like that, but I've just never in my life seen a group of people that get preyed upon as much as the veteran community.
People talk a good game to them. They'd rather you talk a good game. Rater, I've helped people get their claim approved by doing it the right way, and I can't find but one of those people that speak to me to this day. I helped them. They thank me for helping them, but they can't stand me. Because look, you got to either do it the right way, and this is what I'm going to cut you off. I want to ask you, because this really runs me hot. Do you think they come to you, hey, I got all the pieces. I just need you to insert this one piece. I got the system together. You just put this one part in. That's all I need from you. Don't worry about the rest of it. Do you think they approach y'all like that, or you like that?
Some people do. So we have a multitude of things where there are people who are tired of the same old, of empty promises followed by, empty rewards. There's no rewards, there's no nothing. People are really gun shy about being fleeced. So many people have been fleeced out there that it's sad. A lot of people want to come to us because they want to see, okay, is there any chance I could get some extra back pay?
Okay.
That's a lot of people come to us for that. And we do find a lot of that. We do find a lot of situations where it's like, I'll review the claim again. And yeah, you should have been 70% going back to 2022, evidenced by this, this, and this. And the way that I'm able to review that is like if somebody called a quality error on me,
okay,
this is how I would fight it. They said you rated it at 70%, but you should have rated it at 50%. The way that I fight the way that I organize my evidence is if I'm trying to fight a quality error and I present the facts just like I would try to win a quality error, because the DRO is a quality review person. Exactly. That's what they do. So a lot of the time I get very frustrated with people that don't understand how the internal process works, and they don't care how it works. They just want to feel how they want to feel about it. And sometimes that leads to them going to the Board of Veterans Appeals. That's fine. You want to wait 4 years? I mean, okay, but what if I could tell you that sometimes we can win things in 6 days?
They want their day in court, Raider.
Well, I can respect that, actually. I can respect that. That's at least a reason, right? That's a reason why you want to do it. It's a personal belief that you want your day in court. You want them to admit that they were wrong.
Yeah.
Well, I'd rather win than prove a point.
I agree.
So like the other thing is, we've had a lot of people that are like, wait a minute, I won. And we're like, yes, congratulations. They're like, how much do I owe you? You can't pay us for that. And they're like, what? What do you mean? You did the thing, you worked it. Like, there's one person that they've been denied for their back since 2004. And I was able to organize the evidence in such a way that goes, yeah, but you shouldn't have denied him. This right here. But because they broke their continuous pursuit, they only got, it was April. So they got it from like April 6th to April 15th. That's how long it took to, get their claim done. Okay. So they didn't get any back pay. So so we did that for free. And yeah, I'm fine with it. They're like, oh my gosh, I'm so sorry. And I'm like, what are you talking about? It's fine, man. I'm happy to help.
Well, see, some people want to make sure they do right by you because you did right by them. And this is what I want y'all to understand. When y'all sit out here and y'all criticize like, oh, people are just, they doing it for the money. Well, it's not always involving money. It's involving helping veterans, and people should get paid for the service, especially they're not getting paid from the veteran. They're getting paid from the VA. Go ahead, brother.
Well, I wish that they would make the VA's pay system a little bit more equitable, to where I understand where some people are coming from. 20%. If I help to get them $100,000 in back pay, I'm getting $20,000 of that. And they're like, why do you deserve that $20,000? And I mean, it's a valid point, but it's also a valid point that without us, because we should be the last resort. You should try everything else before us. But if you wouldn't have gotten that money, 80% of something's better than 80% of nothing.
Well, once they got the money, once people got it, they have what you call, they want to backpedal and take that. Well, I don't feel like you did enough to get that and all this. Well, if you got to pay your lawyer, you got to pay them, because before you get your money, from what I'm assuming, it comes right up out the back pay. It's buyer's remorse. I want your help, but I want to do it. Like the other day, let me tell y'all what happened. I had a TV. I got me a new television. I had a 60-inch. It was older TV. So what I did, a guy was coming through. I gave him some other stuff for free. And I say, well, hey, man, give me $60 for this television. He, oh yeah, I'll come tomorrow and get it. I said, nah, you can take it today. Just come and pay me when you get it tomorrow. You got to go get the money. I'm pretty sure he wasn't coming back, and he didn't come back. He gave me his number. He never. I'm not gonna beg him for nothing. That's on him. Because if I did not want him to have a television, I wouldn't gave it to him. But that's how it is. And you wonder why people become suspicious, because when you sitting here changing the game.
Well, I mean,
Lord.
I don't know.
I could have gave it to you. I'm sorry. My daughter finds she's gonna chew me out because she said I give stuff away. And they had a garage sale Saturday. I could have sold it here at the house. Go ahead.
Okay, Jason, and yeah, I mean, I've got to write up somebody's. I'm not going to point at anybody, but I've got to write up somebody's clear and unmistakable error soon. But there's a lot of work that goes into it. Like, I'm still researching some people's stuff as to going back in time to, like, I forget what it was, like 2014 or something like that. You know, like, it's a big deal for some people. But there's this really weird thing where it's feast or famine. Sometimes you get paid more than you should by some veterans, and you don't get paid by anything by other veterans, and you did work. And I wish that they would come up with a more equitable system that reviewed the pay a little bit better. Like, I wish we could get like pennies on the dollar for helping veterans get increases or supplementals or, you know, like new claims and stuff like that. And then maybe put a more stringent cap on the back pay for other stuff. You know, the stuff for the clear and unmistakable errors. I could get behind that if that was something that the VA wanted to do. But currently we have to color in the lines the VA gives us. So it's not anything. And in the future, we are planning on doing some like discounts on Memorial Day and like stuff, and just,
you know, like Black History Month, you know. Well, that's the Boy, if H-Town don't find a way to shoe in Black History Month, listen, I want y'all to look at it like this here, okay? They got a big channel where it's not a veteran channel, but like VAD TV. So they do have different people on there. So a lawyer was saying he said, hey, you got to pay me more money this time. And people like, oh, why you want more money? It's actually, but he said, let me explain. When he just have rappers or other celebrities on, they don't have to prepare for nothing. A celebrity just come up there and talk about their life, right?
Uh-huh.
But when he comes up as a lawyer, whatever situation, case they talk about, he has to research it. He has to be informed about what's going on. He has to make sure that he has to memorize things. So when they ask him, what do you think about this happening? Well, the law says this about this and that. Whereas that's what I'm saying with y'all. Y'all don't understand what they say. Y'all, some people don't understand. Ray and them have to research this stuff.
And that's why it's going so slow, unfortunately. Now, I really wish we could just help people with increases, where I could just go, yeah, sure, increase. Yeah, sure. Let's just file an increase. Yeah, sure. And then, you know, like, that's not hard to do, right? But looking up rules and regulations can be challenging. Sometimes it's not, because that's, yeah. Go ahead.
I mean, so what's the hardest claims to deal with, given the process that takes longer to research, the longest? Is it the veterans with not enough information, or they waited too long to appeal, file for the claim? What is the biggest obstacle to get over when helping veterans with their claims that you found?
In all honesty, there's a couple. So the first one is when something predates 2017, there's no formal, like, sometimes you've got to look in common law for what the rules and regulations were at the time. You've got to check certain, like, it's not like it's in the manual. The manual isn't that old. And the 38 CFR isn't that old. When did
it become pivotal? Why are those dates pivotal?
Like
2017. What happened?
they took the book, that's horribly just archaic book, and made it into an online resource. So you'd have to have old copies of the books. So you've got to research, like you've got to take time and dive into it. You can't control F and find this stuff. Like you've got to actually research some of it.
And go
yeah,
ahead.
go ahead. I was going to say sometimes AI is used to help track it down, but you've got to double, triple vet it,
Okay. And what other kind of claims are hard to deal with,
hard to deal with in terms of
as far as they take a while to research, they're challenging when you're dealing with the veteran claim. Say, well, okay, we're going to take a lot more research. You're going to have to give us more information, or we're going to have to. If I'm dealing with the VA, I'm going to have to word it in a way, and it's going to be difficult. But you coming from a rater perspective, you may be able to do it, but you already know how those raters think. And it's going to be hard. Just like we brought up tonight about the medication. You say, yeah, that's possible, but it's going to be hard for a rater to accept pain medicine as an addiction secondary to a service-connected disability. When do you have challenging situations like that? How do you deal with it? Go ahead.
Okay, so when things are not clear and unmistakable, right? So if you're trying to call an error on something, what might be clear and unmistakable to the veteran is not clear and unmistakable to the M21 at the time. A lot of the time, and I'm not digging on people or nothing. I'm just saying, where people come to us and they say, look, I've got a clear and unmistakable error going back to 2005. This, and this happened. And it's like, yeah, but that technically wasn't a clear and unmistakable error. Like a lot of the times when they say, well, the examiner said no and they should have said yes, but they didn't say yes. So it's not clear and unmistakable that they said yes. You'd have to clear and unmistakable is so unmistakable that you could hand the claim at the time historically to anyone that does claims and they should get the right outcome. So that's the problem with clear and unmistakable, where veterans' interpretation of what that means based upon the Board of Veterans Appeals, and this is why I've got a little bit of a salty spot for the board currently, just because people try to project the board onto the VA, and it is like trying to project chess rules onto checkers, and it doesn't work, but those are oftentimes some of the main things. Like so far, everybody's been awesome. Everybody's been patient. It takes me, I've been doing, I did 30 something reviews this weekend. I couldn't do any today because VBMS was down, but I'm trying to do 10 a day during the weekday and then 30 to 40 or so during the week, because we have about 750 clients or more.
Okay.
And not every single one of those are going to be awesome money or anything like that, but we're going to help out as much as we can.
Let me ask you, you spoke of a DRO earlier. I'm assuming you're talking about a decision review officer. Do you ever have a situation that you would challenge what a DRO said, or you can't challenge it, or they have to go for the Board of Veteran Appeals? Would that be one of the most difficult claims to fight?
No, not really, because what happens is, let's say you do a higher level review and the DROs huff and paint, and they decide that it's my way or the highway. I disagree with what you're saying. All you have to do is from there, you pivot to a supplemental claim. You add new evidence to support your, whatever the best and most likely outcome is to successfully grant. And that's how you do it, is you do it with a different supplemental claim. But one of the things that's been exceedingly challenging is when veterans have their own higher level reviews or claims open in the middle of it. And they're like, hey, by the way, can you fix this for me? Because I kind of claimed this and it's all jacked up. And I'm like, why did you claim it if you were going to go with us? Because now you have to withdraw it, or you have to change it, or I've got to scramble because of, you set us down a path that I wouldn't have chosen.
Can I say something?
Sure.
And to the people, I don't want to be them mad at me, but I don't like when people do stuff and then want you to clean their mess up. Sometimes it's done by naivete. Sometimes people just do it for the hell of it. And they say, well, I'm going to do it my way, and I'm going to throw this in your lap now. You know?
Yeah. And it is not ideal sometimes. Now, it's not irreparable. We can't not potentially fix it, but it does cause, like, it's one of those situations where a lack of planning doesn't constitute an emergency, but we make it an emergency. So,
okay. Well, they got some people have taken umbrage with what you're saying. They think you should give a Juneteenth discount, a sailor discount, and do you accept food stamps? Now it's a senior sailor discount. Go ahead.
Wow. I will definitely take that back to Blake to see if he is willing to adopt those things. But that's up to Blake when it comes to that decision making. But I do know that we are talking currently about, doing some kind of discount for veterans in the future. Maybe certain types of claims, maybe, and those are the only ones that we can charge for, right? If we can't charge for it, like it's a new pro bono claim, we can't charge for it. So there's no discount needed, right?
Yeah. And so to be clear, because some people make it, if you're an accredited agent, they can, Mr. Blake, they can take an initial claim. They just can't get paid for it. Is that the case?
Correct.
See, a lot of people didn't know that they got to wait. Now people, they choose to wait because a lot of them want the back pay, but they'll be helping people. And y'all are helping people with initial claims? Please tell me you're not helping people with no initial claim. Yeah, you're not getting paid for it, bruh.
But yeah. So some of the people I just screened and I was like, I'm just going to meet with them. I just want to meet with them. They were on the beta test. So a lot of beta testers were pro bono claims. Mm-hmm. And I just helped them. I just filed their claims for them. I just kind of do stuff. Like tomorrow, let me see here. What's tomorrow's schedule look like?
And you say y'all got so far 750 claims or so, right?
Clients.
Okay. Wow. I don't mind paying for it, especially if I'm finally getting it. I would do something like this. I'm telling you. Yeah. Now I would, but verify the information. But if it's through, you got an accredited person you're working with, they handling the business, do it. Let me see. Charles say 100% shipmate. I'll be on the board with that. We have Mike Peterson in the house. Say, I don't have a master bread dog discount. No discount, huh? Go ahead. Any questions? Say, well, I had the claims in already, H-Town and SIB should have notified me 2 months earlier on their new endeavor. I will be emailing them if I fall flat on my face. Now, this is something that I wanted you to be clear about, bro. That let them know that if they got the claim, you said this before, that if they already got the claim out there, you can come in and help them. But if they already got a pending claim, what's your concern? And we want to say, Patricia's in the house, join her. Say, I have learned the most from Raider. Isn't that incredible? Everybody show love to Patricia. Go ahead.
I mean, I thank you for that, number one. Number two, I don't think everybody agrees. I don't know. I don't even understand anymore. But yeah, I've been getting a lot of hate lately just because of this endeavor. Like, it's hilarious sometimes. Like, people are like, "You're a claim shark," and I'm like,
"What?"
That's the dumbest. Yeah, it's the dumbest thing I've ever heard. It's like it's sanctioned by the VA. That's the easiest way to put it.
I mean, what is the? You came out and was clear, bro. I mean, cut you off. Sorry. You came out and was clear what it was and what it was not.
I know, but I don't know. And then I'm also having this thing where anytime I speak about any changes, people like
changes to what? Now, like, changes. Go ahead and speak your mind
to the VA.
Yeah. Okay.
Like, it is exhausting to have people that never worked at the VA say that interpretations of stuff that happens at the VA, it's very weird. Like, I don't know. It's one of the, that's what I did not think on my bingo card would be there. To like, what is the most exhausting part of this endeavor is people saying things that are overtly not accurate for the VA. Because I never talk about the Board of Veterans Appeals, right? You will never hear me talk about that because I've never worked there. I don't know anything about it. And I have the integrity to not talk about it because I don't know anything about it. I just wish some people would get the same integrity to not talk about things that they don't understand. And it's driving me nuts. Like, that's the thing that's exhausting is
what's the most exhausting, frustrating thing? The misinformation that people are putting out. And why do you think they're putting it out? Do you think they just hating on you because they don't want to see you succeed? What do you think?
No, I don't think it's that. Like, nobody's that mean-spirited. What I think that I want this to be true is where it comes from. I want this to be true. You have to follow the law. I want this to be true. The VA has to follow the law. And I'm like, okay, but how many times has the veteran community sued the VA for not doing what they should do and won? How many times, guys? Like, it's, and people just want to pretend like that doesn't exist. Like, the VA doesn't constantly choose to do the wrong thing. And so I don't think anybody's really being mean against me or against anybody at the company. I just honestly think that they want the process to be a legal process so it would make sense. And I don't disagree with them, but that's not what we have. We have a procedure-based process, and then we have the Board of Veterans Appeals, which is a legal process. And they are like oil and water to each other.
Okay.
The secretary can interpret the case law however he wants to.
He can.
And then do laws and regulations under 38 USC 501. He can do it however he wants to. Sometimes he's got to go before Congress and say, hey, look, I want to, that's where those 60-day periods for the thing, I'm making this change. I'm going to give you guys a comment period of 60 days. And then I don't care what you say. I'm still going to do it anyway. Like, those things. Like, but I think people really wish that this would turn into a legal process. And if it did, I mean, cool. But you'd still have people that would have a manual that they would follow, and you would not have things that would be the same as you think it should be.
They think it would be cut and dry if it was a legal process, and it would be more structured and predictable, per se.
Yeah, and I think that's true. I also think that those individuals, if they got employed at the VA, would wash out in under 3 months because they would not be able to psychologically reconcile that they can't follow the laws and they have to follow this dumb manual. They would wash out of the job. And that's just a fact.
I heard during that hearing that I recently saw, we're going to go over it, family. I want to do the day of that. They having problems with having enough qualified people in those positions. Raider, you let the VBA down and you left. You're not the only one. They saying that they're doing a more workload with less people, less qualified, getting them trained. I say, oh.
Yeah, and that's terrifying. That should be terrifying to each and every person out there, that they're doing more with underqualified people. And when you have underqualified people that are working quickly, is that a good thing or a bad thing? And I know that I'm going to have some contrarians out there that say that was a great thing because faster equal better. Like, there's no amount of, like, I sometimes don't get it. Like, it's the internet and people on there just like to say things just to be contrarian.
Yeah.
But this is a true thing. Like, this is people's lives. Like, people's lives are revolved around what happens with these claims. And that should matter to people. That should
I
matter
was
to
thinking
everybody.
that too. I was thinking that too. Dome, you're right on my mind. Listen to what he said. What if they call you back to duty? What would it take for you to drop everything you're doing? What could they offer you? They say, like the Godfather, we're going to give you an offer you can't refuse for you to come back to your job, come out of retirement.
I mean, part of the reason why I don't work there anymore is because of my reasonable accommodation to work from home because of my mental health thing. Because I suffer from agoraphobia. Yeah. And I couldn't work in the office all day. I mean, like, would I go back? I mean, maybe. But they'd have to fire half a QRT. I mean, it would be like a family reunion at that firing because almost everybody's related to everybody there. I wasn't related to anybody there. And I had to climb the ladder on skill and expertise. I didn't have a cushy, like my last name could elevate me to somewhere higher.
Well, wait a minute. You're not saying that there's nepotism at the VA. No, you're not saying Ray. This is a Raider exclusive. I dare you say it's like the Hatfields and the McCoys in there. Excuse me, sir. Where have I been sitting outside too long in the rain?
I should pull up because I still technically my email access. I still get like regional office emails. You should look at the CC too on the emails. It's like 155 people, maybe 55 different names, like last names. Like it's the weirdest thing. Like it's like okay. I'm not gonna say their names because I'm not gonna dox them.
But they got family members. They working in there, and it's always like Jerry Springer keeping it in the family week. Wow,
third generation people living in there. You got the grandpa, you got the mom, you got the daughter. Third generation. I mean, this is a job, and part of the thing is it's a government job, right? That pays really, 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 really well. Like you can make six figures doing this job, and you don't even have to be good at it to make six figures. You just have to sit in the chair for long enough to make six figures. Like it's not a skill. It's not a rewards are equated to skill.
Okay, we got our sister Grace Smith and it's a Evening H-Town family and Raider HQ. Raider HQ opened up the floodgates and brought her over too. Thank you for being here. The U.S. Army Grunt say, I will say I haven't filed any claim since 1997 because no one cared back then. Since October 2020, October 25th, I have learned a lot from watching folks like Raider, and I put in three new terror claims last week. I hope I did. Do y'all handle terror claims, brother?
Yeah, I do. Yeah.
When you're dealing with the terror claims, when do you know it's worth doing it or not? So if I come to you and I say, Raider, I'm 100% already, I could do the undiagnosed illness or terrorism. I was in burn pits and stuff in the first Gulf War. When would you tell me, it's practical for you to do it or it may not be practical?
The only reasons to do that would be an earlier effective date of your overall 100% award, or you'd have to have some kind of actual value added, like an SMC or something like that.
Okay.
Yeah.
I'm listening. Go ahead. So, fam, y'all hear that? So it has to be a real reason to do something like that because it may not be. Will that open up if you're 100% permanent total, will that open it up?
It could, depending on how you claimed it. Hey, H-Town, I do have to go though.
We're gonna let you go.
Okay.
Okay, brother. You take care and take care, Luna. We glad you came through. Hopefully we didn't hold you over it. It's who you know, it's not what you know. Okay, take care, brother, and you be blessed. And y'all go over there and to Raiders channel if you haven't been over there and support him. Thank you, brother.
All right. Good night, everyone.
Good night, brother. Bye. Family, that wasn't that all right? Wow. Dome, everybody so love the Dome. Family, we over here doing our business, and the good people come. We got crazy people come here once in a while. You see our brother come over here, he busy doing things, and he took time out of schedule for us, and we thank our brother Raider for that. Are you saying it's who you know, not what you know? It sounds like it. Now listen to Brother J. Oliver. The VBA is backdating actions. They are time traveling to look good on paper to Dougie and the auditors. Wow. Everybody in here. Dome, I'm so glad you're here. He say, Charles say, evening shipmate Grace, you here for the Raiders sailor discount? Yeah, you see, nasty, they gonna get a discount on their business. Jason listening homework. Yes, indeed. Dome say, what is the family ethnicity? The problem with this is, Dome, that we got, I don't think that matter because we got a whole bunch of black ones down here. They give you more hell than anybody else. They more hell on their own people. I'm telling you. You get a whole bunch of black family members in there, they'll be, oh, and I'm black. Oh, you don't need nothing. You don't need nothing. I just want fair people in there. Now listen, Jason M say, yes, I'm listening and taking notes. Family, that's what we're doing tonight. Family, we did this thing tonight. Did we not do it? And we thank y'all. Y'all been so incredible. We were right at the after party, so thank God for that. And Patricia joined us say, I think, let me get this here right. Let me kick this from the stage. I don't know how to do that. Stop screen. Okay, now I think it is all potluck on what the Examiner and Raider you get. Okay, so anything with the government is horrible. I work long-term care and deal with MDs for billing very intense. Oh, I can imagine. Thank you, Patricia, for sharing. And we thank y'all. Some of y'all look like y'all subscribing. And if you hadn't had a chance to hit that like button, and if we're able to win your subscription, we'd appreciate it. We have people like Raider HQ coming over here and supporting us, and we all interacting. We growing. He has a channel way bigger than mine. He has over 10,000 subscribers more than me. But I tell you what, come over here and share with the family. We appreciate it. Now, and that's got a lot to do with y'all, not me, the quality of the audience here. And many of you from over this channel, many of you from over here. That's government. One gets in the door, then holds open for the others. Yes, indeed. They do that in Congress. They be trying to wait for their family member to take the position. They have to have Mitch McConnell have two people walking in here holding his arms up like forever chemicals are keeping him alive. You know, walking him in. He can't walk. I wonder, do he know where yet? Yeah, and you got a whole bunch of them like that. James Clyburn, he want to give to his Jim Clyburn want to give his position, I'm assuming, to his daughter. But that's probably we at the after party, so you can talk about anything you want to now. So, family, y'all know we are at the after party. My sister Betty, long day, yeah. Betty about to say, Raider, you're saying you straight teeth, you have no relations to those people. Wow. Everybody talking to the fam in here. Discount charge should make sure. Why not, right? Family, y'all in here, we thank y'all for showing up. And everybody said thanks to Raider. He had to leave. So thank y'all. Good night to Raider. And be blessed, Raider. Because let me tell y'all something, family. We at the after party here. We got 20 people in here. We thank y'all for showing up. Wow, another great one, H-Town. Let me tell y'all something. You think, well, H-Town, he be out here blocking YouTubers, big time YouTubers sometimes. It's not personal, it's business, because it ain't just so much disrespect to me, disrespecting the channel. My brother come over here, Raider welcome. Anybody welcome, as long as you respect the house. When I go to your house, I'm going to respect your house. I ain't going to kick my feet up on your coffee table with mud on my boots. Matter of fact, I ain't coming to your house with mud on the boots. I take my shoes off, even if you say it's okay. No. U.S. Army Grunt, I'm glad you're here. Yes, indeed. U.S. Army Grunt, have you been doing good on your health? I thought you had said something a little while ago. I hope you're doing all right. And we, Jimmy Elmore, thank God, and we for your recovery. Our brother went through some medical hospital medical situation. So pray for him, and we thank God for him. Now tell me this, Mike Peterson. Tell me this, our sister Patricia. How did y'all find the channel? And tell us your branch of service and the place you're living in, currently living in, state or country. Betty said we got 27 likes and 18 watching. Family, this has been a blessing. Say, Mike Peterson says, hey, I want to hit that like button. Where is it? You say I found it. Hit that like button, family. Come on, hit that like button. We so glad you're here. We so glad that you are here. Let's see how we looking on it. Man, I can't stand things because they keep talking about it show from way back then. Let me see what we got. All right. All right. Let's see how many we got. Ooh, we got 29 likes so far, it looked like. I found it. It say, prayers over our claims, U.S. Army Grunt. Yes, indeed. Anybody got an open claim? Put the word open in the chat. If all your claims are closed, put close in the chat. Anybody got open claims? Or you through with all your claims, they're closed? Open claims are closed. Put it in the chat, fam. Let us know. Anybody got an open claim? Betty got an open claim. Family, let's see what we got here. Take those shoes off. You know how we talk. Boy, if you don't get out them shoes. Yes, indeed. 30 likes, 18 watching. Yes, indeed. She caught up faster than me. I thank you for that, Betty Bops. We need you here. You just showed up on my feed. Wow. I am not military. My husband is, and I'm working on his first claim. Listen, you need to listen to this channel. And Raider HQ just retired as a Raider evaluating claims. Go over there and check him out too. But with anybody, I say verify. When it comes to me, him, or anybody, because they got, okay. Yes, indeed. And please subscribe. He said I did. Come on now, family. See, this is here. You're welcome here. We don't ignore you. You don't have to pay us no money to get your questions answered. Now, one day I'm going to get monetized and we do prioritize some super chats, but we still going to answer as many questions as we can. Oh, that's a blessing. Everybody, thank God for you, Patricia. That's why we here. Now, listen, U.S. Army Grunt say, yes, Mr. H-Town, I have been doing okay. A boatload of appointments and just waiting until all the tests is done. And I mean, so that they can tell me what we are doing next. Oh, praise God. This is good. Grace says, yes, I have had a nice weekend and looking forward to another one on Mother's Day. When is Mother's Day, Lord? Tell me what day Mother's Day. Now listen, Betty Bob say open claim. Do you have any open and closed claims? Then Charlton say open claim. What? So that's why you come out. We have videos on filing claims, Miss Patricia. 66 Love say open claim. And when the after party, you have any questions, We are competent here. We got competent people in the audience that can help guide you where you need to go. Have not filed yet. Okay, for your husband. Jay Oliver says closed. So he got all his stuff straight. He ain't open. Betty say open. Mine closed for now. Say happy Mother's Day. When is Mother's Day, family? I gotta know. He said, I did. Okay, you did. Thinking about Tara, just like U.S. Army Grunt. Okay, so you might open a claim. I thank you, U.S. Army Grunt. Yes, indeed. Family, y'all just such a blessing. Everybody show love to Benny. The doors of the church are open. You know what's up. You know what it's all about. Now, Patricia say, I am collecting information. I am collecting info, record testing. My husband is vision impaired, so he can't do this. Thank God for you. Thank God. Anything we can do to help you, let us know. And ask questions. Any questions of us. Say May 10th. Okay, May 10th. Okay. Now listen, Grace said, my mom, my grandmothers, my great-grandmothers are gone, but I love them. Might go by their graves. Early Mother's Day to all veteran mothers. Yes, early Mother's Day. We probably going to be on Tuesday. Next Sunday is Mother's Day. Oh, boy. We're going to have to acknowledge Mother's Day next week. And thank you, Miss Patricia, for being so kind and helping your husband. Thank you. God bless you. And we're going to do whatever we can to help you, whatever we can. Thank you, Grace. Happy Mother's Day. Say happy Mother's Day to Grace. Happy Mother's Day to our sister Betty Bobs, Alaskan Ice. Miss Patricia, if you have children, happy Mother's Day to you. Let's see. Hi, Benny. Benny in the house, family. Benny in the house. Now choose a topic. Is there anything else y'all need clarification on? We have the after party. Anything. Choose the topic you want to discuss. We're good. For those, we ain't gonna go in no VA law today, but what we gonna do? Because we've been here a while. What I want from y'all, if y'all let y'all have some more, everybody say happy Mother's Day. I do want to know, what is that weather looking like where you at? Then we got U.S. Army Grunt say, early happy Mother's Day to all mothers in the chat. Yes, indeed. Thank you. Happy Mother's Day to Grace Smith, too. Yes, indeed. Pardon my negligence. My sister's happy and blessed Mother's Day all day to you all. Yes, indeed. Hey, let me tell you, I love mothers because my mom was a woman. Did you know that? Yes, indeed. True story. He said, yeah, to my sister's Mother's Day started early. Everyone, okay. Now listen, Benny say, has anyone ever had to deal with the patient advocate before? I think I did. Let me ask y'all, let them know, Brother Benny want to know about the patient advocate. Sister Betty, if you have any advice on that, how do you need to talk to your patient advocate? How do you know you got somebody working for you or they wasting your time? Let us know. Now listen to Brother Charlton say, I took my mother to see my first ship and some of the subs. I worked in 1997. So glad I did. I know you are. Tell me what that weather like where you at, in particular, what that temperature like, and what state you in, a city or whatever you want to put down. Or you can just put the temperature. Patricia say, good place for lay statement templates. Alabama, 58 degrees. That's right. We here for you. This is centered for veterans, dependents of veterans and non-veterans. We welcome everybody. Jason them say, wait, Mother's Day is going on the 10th, right? And I'm going crazy. Man, I thank God for y'all. Now, man, I ladies and gents, I feel really blessed to have y'all here. Y'all just don't understand. Y'all keep putting up my subscriber count. Y'all give me 2 minutes. We're gonna make 3,000 before it's over. We got several tonight. We got 2,896 subscribers. How many do we need to get to 3,000? We got 2,896 subscribers. So subs 2,896. Make sure you tell your mom, show love to your mom. Now listen, Betty Bob say, Happy Mother's Day with or without children. Women are always the caregiver. Let me tell you why that's important. I got a picture of my 2 great aunts in there. This is my great granddaddy's sisters. And he used to take me over there and sit with his sisters. And one of them, my auntie Sarah, she was always quiet. Like, what did she was just, now she wasn't quiet, she was laid back. My auntie Desi, God, you just don't understand. She reminds me of Rosa Parks. Her complexion reminded me of. She showed me a picture of my grandmother, which was her niece. This is my great aunt now, and showing me she just quiet. She would be cleaning in the house, and you wouldn't know she was there. She on the floor cleaning up. Never had a child, but she was mother to all of us. Did you hear what I said? Her husband had passed. He was in World War II, I think. World War I or World War II. World War I, I think. Yeah, World War I. And he had passed, and she had a house. And I'm telling you, Aunt Desi never had a child, but was mother to all of us. Come on now, family. Now, let's see what we got here. Benny said, getting the run around about transferring my mental health care to community care and patient advocate is not helping much. Fire him and get another one. Betty, you got any ideas what he can do with that patient advocate? Don't say nothing crazy. Grace says, Jason, it's next week. I just mentioned and looking forward to another great week. Next week is Mother's Day. Now, do you have any of your children coming home? Y'all gonna meet somewhere? What do you think y'all gonna do? It's a surprise. Now Jason say it's on the 10th, right? Yes. Right now we have 2,896 subscribers. We need 104. Family, if y'all know, let's get the word out when we get over that 3,000. Only 9% of YouTubers make it to 1,000 subscribers. We're about to triple that. And I thank y'all. And I thank people like Raider. Yes, indeed. And the salty old Marine. Thank you. Now, Grace say, yeah, Jason, 10. Betty say in Maryland, the temperature is 49 degrees. Here in Houston, I'm in Richmond, it's 67 degrees with the low of 55. Oh, it's going to get cool. Now, listen what Mike says. Did I miss something? I'm sorry, brother. Pennsylvania, right by Maryland, 52 degrees, clear in Pennsylvania. Okay. Mike said, I am just looking for a VSO in the Metro Detroit area. Anybody know of a good VSO? Look for the American Legion. You're going to have to test them out. Okay, Mike? I don't know. I'm not from that area. That can help me with my first claim to tinnitus, secondary PTSD, and anxiety. Listen, you're going to have to vet them. You're going to have to go in, get the information that we give you. Go look at my videos on claim process. Go watch some of Raider HQs, because even if they help you, you need to know what if they're telling you the right thing. Grace says 60 degrees in the tide water Virginia area. Virginia Beach, Norfolk, Chesapeake. Come on now, that's the Tidewater area. I was up there. Listen, breaking hearts and getting my heart broke. I ain't gonna say she broke my heart. She scared the heck out of me. I'll tell you that much. Now listen, patient advocate going to the next patient advocate. Oh, look, patient advocate, go to the next patient advocate or call the 1-800. I have sent it to H-Town. Yeah, in the past. I don't know where it's at. Did you just send it to me now? You can put the number in the chat if you got it right now. If not, let me see. Let me see what I got going on here. Ooh. All right. Now, okay, we'll definitely. Now, 66 Love says that where 66 Love is 55 degrees and cloudy in Cincinnati. Yeah, definitely. Please, Mike, go ahead and start vetting and looking. Get word of mouth helps too. Benny say thank you, Betty. 64 degrees in Sacramento. I'm assuming that's California for Benny. H-Town I have sent it to you. Yes, indeed. I got that. Now, thank you for letting me know. We'll definitely try to get it. No, I don't know what they think. Family, I want to thank y'all for showing up tonight. I want to thank y'all for being here tonight. I want to thank y'all for the love and how we don't let nothing stop. Huh? See, even Raider was saying, wow, this is an interesting topic. Did you see that? H-Town get that information. When I talk to y'all, I come up with questions. Yeah, it's possible. Yes, indeed. And family, did we do it tonight? We showed up and showed out. What did we say? And for those who didn't watch, go back and watch the whole video. It says, can veterans receive VA service connection for addiction to pain medication? Yes, indeed. And if we hear anything, we'll let you know, Mike. If I might, if you from that area of Detroit, help our brother Mike. So okay, thanks. Family, we about to close it out, and we want to thank y'all for being so incredible. We thank y'all for showing up. Let's say good night to each other now. Good night, Mike Peterson. Thank you so much for your kindness. Thank you, Betty Bob, for holding it down, setting the decorum of the room. Say, Benny, call the 1-800 number. They will act either helpful or aids. Thank good night, Benny. Thank you so much. Good night, 66 Love. Good night, Sister Grace. Thank you so much. Good night, Charleston, my brother. So glad for the information that you sent to us. Good night, Brother Jason M. Thank you for being so kind and being so supportive here early. Yes, indeed. Oh, yes, Lord. If you got the number, you put it on the chat. Let me see. Thank you, Sister Patricia Joyner. Keep helping your husband, and we're going to do everything we can to support you and supporting him. U.S. Army Grunt. I may not get to everybody, but please be patient with my family because, we're getting ready to close out. Family, we thank you. Oh, yes. Thank Raider for being here tonight. We appreciate you, Raider HQ. Please go over to his channel and subscribe if you haven't done so. And, check him out. He very knowledgeable. I learned a lot from him. And I appreciate his support over here. Alaskan Ice, thank you for being so incredible, being so supportive. Thank you for Big Blue. Thank you up in here, Big Blue. It's all good, baby. Then we have Farm Girl Rebel. Thank you. Raider HQ. Thank you, Farm Girl. Get your rest. I hope you feel good. We're praying for you for your speed of recovery. Family, we doing this thing the right way. Look, y'all leave now. Y'all starting to come back in the room. I don't know what. Jay Oliver, thank you, my brother. Thank you. I almost thank myself. Brother Sean, thank you, Brother Sean. for being such a committed, supportive person. You too, San Diego Marine. Appreciate you. Appreciate you. Family, we talked about this thing tonight, did we not? Huh? I put my Southern swag on it. You understand? Listen, Brother Henry was in there tonight. Thank you, Brother Henry, for your kindness. Brother Jimmy Elmore had to call a quiz. Thank you for being in here. Thank you, Brother Jimmy. Pray for that speedy recovery. Then we have T Bird in here. My family last name is Bird. You know what's up. Thank you. Yes, we shout you out here. Yes, you're important here. Yes, you are the center of attention up in here. Yes, that's what we come here for. You understand? Tell you something. Brewski, my brother, I apologize to him tonight because I want him to speak his truth. And he said, it's all right, H-Town. Thank you so much. I love you, Brother Brewski. I want you to speak your mind. I don't care who it's about, who it is, even me. You speak your mind. And I thank you so much. Say good night to everybody, family. Yes, indeed. Hope I ain't missed nobody. If I miss you, charge it to my head and not to my heart. I thank you so much. Boy, y'all are just doing this thing. Oh, this has been a true blessing. Y'all don't know how good this make me feel. This really does something to me. Cause y'all stand with me. You know, y'all don't know how important it is. Now let me get to the bottom. We're gonna close out. Let's see what we got here. Betty Bob say, have a beautiful weekend. I will. And they talking. Y'all say good night, family. And then Benny says, hello, Betty. Okay, Betty, to reach out to them. Yes, indeed. And you call them, they give you the number. Rest well, family. You can go to your clinic and ask for another. Charlton say, good night, shipmates. Another shipmate, H-Town family. And this is a family. That's why people are drawn to us, because they want to know what we're doing over here. We ain't doing that, just chilling. Now, Grace says, H-Town, have a blessed week and family, brothers and sisters. Happy Mother's Day before pre-Mother's Day. And when I can't wait to come up there and meet y'all and we have some fun up there and I'm going to move around the globe. I don't like getting on no plane, so I'm going to be driving everywhere. If I can avoid a plane, I'll get on it, but I don't like them. Now, Betty Bob says, H-Town I have to get to make sure it's the correct number. Okay, when you get a chance, we'll probably put it up in the description of the next video. Oh, good night, everyone. Have a nice week from Brother Benny. Benny been around here a long time. He brought Rose City D in. Am I right? Jason M say, night all. Have a blessed week. My heading back to the U.S. on I'm headed back to the U.S. too. Okay. Safe travels, brother. Safe travels now. Should make awesome sauce week. Oh, listen, say good night and bless everyone from Mike Peterson. Yes, indeed. And then Grace says, U.S. Army grunt. Be well. Yes, indeed. With love. Betty Bob say, Grace, have a beautiful week. Have a lovely Mother's Day. Yes, indeed. Betty say, good night, T-Bird. T-Bird, good night. Grace say, my sister Betty, peace. Grace says, thank you, H-Town. Yes, indeed. I haven't seen OT. I've been worried about him. I hope he's doing okay. OT, if you're out there, we got love for you, brother. And you always bring the good energy. I pray you're all right. And you let us know if you need us. We here. Safe travels, Jason. Yes, indeed. HT, the GOAT. Hold on, H-Town, the GOAT. What made me the GOAT, man? You know what I'm saying? I'm over here scraping up pennies. I'm up here. I ain't even made 3,000. How can I be the GOAT when I'm down here? Coach, let me in the game. Let me in the game, coach. Betty Bob say, H-Town, they will not give him the number he really needs to call. Well, you get it, and we're gonna put it in the description, okay? Nah, they if you got it, Get it to us and we're going to put it up. I'm going to make a slide for it on the slideshow. H-Town, you have a blessed week. Yes, indeed. And family, I want to tell y'all to have a blessed week. We covered the topic and we appreciate your patience, your kindness, your support, your respect, your knowledge, your consistency. We thank you and we want you to have a wonderful night. Till next time, might be here on Tuesday. Keep an eye out, but definitely on Thursday. Keep those notifications on. Love you. Happy Mother's Day and good night.